As St. Lucians, like most people around the world, were preparing to usher in the year 2020, should have been a fantastic year. A little-known virus was beginning to wreak havoc in a city in China that many of us had never heard before. The virus would later be known as the novel coronavirus, or COVID-19, and the city was Wuhan. On 31st December 2019, the World Health Organization, the WHO China Country Office, was informed of cases of pneumonia of unknown cause detected in Wuhan City, in the Hubei province of China. As of 3rd January 2020, a total of 44 patients with pneumonia of unknown etiology had been reported to WHO by the national authorities in China. Of the 44 cases reported, 11 were severely ill, while the remaining 33 patients were in stable condition. By 31st January, the World Health Organization declares COVID-19 a public health emergency of international concern. Welcome to the Government Information Services Year in Review, the COVID-19 edition. I am Lisa Joseph. In studio with me is my co-host, Jessie Leos. And we'll be having a very special guest a little later on. And throughout the day, we will be joined via Zoom, the Chief Medical Officer, Dr. Sharon Belmont-George, our Minister for Tourism, Honorable Dominic Fede, Minister for Education, Innovation, Gender Relations, and Sustainable Development, Honorable Dr. Gail Rigobert, and the Commissioner of Police, Milton Daisy. Jessie, welcome to our year in review. Now, it doesn't feel like a year in review too much for me because we are still ongoing, and we have to make that clear that COVID-19 is an ongoing concern.
Absolutely, absolutely.
It's an ongoing concern. But certainly for us, in this program, we are looking at COVID-19 from the very beginning. And today, March 13, marks 1 year since we declared our first case of COVID-19 here.
Absolutely. As you mentioned, we continue to grapple with COVID-19, respond to it, manage it, but quite a difference a year makes. We've come through highs and lows in our response to the pandemic so far. Today, the 13th, as you indicated, being the anniversary of our first case, but certainly not the first indication that we had of COVID-19 here on Ireland, and not the first decisive action that had to be taken here on Ireland. We definitely have been keeping watch over COVID-19 since January of 2020. So there has definitely been, a lot of work going into it for over a year, but we're looking at the last years more strategically.
What we will do now is we will take a very short break, and when we come back, we begin with our year in review COVID-19 edition.
Cette lisi ka registre vermin corona ek I ka fait mouvement ek an chay vitesse tan chaque canef ka kouye pour vigilance publique la fait wolo parler en place publique kon bol en main base ti boutique changer distance sociale 6 pieds hod yon a lot I ka travay tan si ou senti ko pa cordial quarantine ko pas en contact et puis l'autre en cas ou te toi pe exposé c'est un ekouye free 11 ou ben n'importe clinique yo pou les pays a dimi à clé ça veut dire les supermarkets pharmacie et puis ATM yo accessible avant c'était souhait pays à clé en plein ça veut dire tout bagay fermé à 24 heures servi protocole comme sorti par bureau indication santé nous tout ensemble ça sauver vermine corona si nous tout servi jid là à toutes les together let us win this war say to shall be a soldier together we can beat this corona.
And thank you for staying with us. The COVID-19 year in review. And as I indicated earlier, we are being joined throughout the program by the persons who were at the forefront of making our decisions regarding our management, mitigation for COVID-19. We do have with us via Zoom our Chief Medical Officer, Dr. Sharon Belmont George. Good day, Dr. George.
Hi, good day, Ms. Joseph. How are you doing?
Doing mighty fantastic. I know perhaps that's not the right word to use, but as we get into the program, we will understand why I'm feeling very fantastic, because our vaccines are here. Looking back at the year, at this point last year, we would have all felt a degree of trepidation, considering that we had our first case. What was your thinking when I know that because you had been monitoring the situation, but certainly you would have felt some degree of heightened concern that we would have gotten a case here.
Yes, it was the reality actually hit us from the Ministry of Health when we got our first case, because as you're aware, we had been planning from January. We had been doing intense planning from January, monitoring the movement of the virus from China around the world, and we were still at stage 1 in our plan, which was containment. So we were doing a lot of source control. And if you remember back then, a lot of our measures are quite different to the stage 3 that we are now in with established community spread. So at that point, we were doing a lot of planning. We were putting together our national COVID-19 plan. We were looking at source control, with aggressive monitoring of the border and blocking transmission. I don't know if you would remember back then, we had our travel bans for certain countries as we monitored where the virus was spreading to. So we heard, I think it was from February 4th when we had blocked persons who were in mainland China for 14 days. Yeah. We extended it by February 26th to include Hong Kong, Republic of Korea, Japan, Italy, and Singapore. And by the time it was March 15th, we had included Spain, France, Germany, Iran, and the UK. So in the initial phase where we were doing a lot of prevention, trying to reduce the possible impact of it coming in on us, there was a lot of source control and blocking transmission. And at the same time, we were doing extensive health education so that the population was aware of what to do and increasing our surveillance just in case. But we were very cognizant of global travel and trade. We are so connected, more than you know, that even though there is a case in one country, it's very easy because of the various travel routes to get a case coming in country, and that is exactly what happened to us. So a lot of planning went into even before we got our first case, and for us at the ministry, it was just like a reality check, like what we were preparing for. And we just had to sit, breathe. It was something we planned. Our communications unit had already prepared all of the holding statements and the mode of transmission, what everybody's role was. So it was just put it in action. And we had gotten what we called, it was like an exam before, like a test with our other case, which was a false alarm. So it's almost as if we had gotten a chance to go through the steps, look to see where the gaps are. So when we got a real case, we just push it into action. But it was a time when the reality really hit us with the first case being announced on that day.
Good morning, Dr. George. Jesse Leonce here. I want to ask, you spoke about the stop measures that were put in place, as well as, some of the decisive actions that were taken. Surrounding that would be the administration and the establishment of certain agencies and call to action of NEMAC as well. Speak to the role of the Ministry of Health at that time. You know you would take a very prominent role and continue to do so. Speak to that role and, the response of the persons, the stakeholders around you. Know that you would have taken on a leadership role as well alongside the Prime Minister. Speak to the significance of that for yourself.
Well, at that point, we were monitoring together with the regional public health agencies. So all of the CMOs on a daily basis, we were meeting and monitoring how the virus was going. Those regional agencies were also working with us because, as you know, COVID-19 was new. So there was no real research, there was no information to guide our public health actions at the time. And as the Ministry of Health, as the technical officers to guide an outbreak, we were supported at the time by the National Health Security Committee, and that committee is chaired by the Cabinet Secretary. So, and that's a very wide, a broad set of stakeholders, and we had to ensure that at every single level that they were prepared to manage, from the ports to the police to tourism to agriculture. Every single level had to be prepared to manage whatever the impact of this was. So the Ministry of Health, we were guiding in terms of the draft national plan that we put in place at that point. And that plan, there were quite a few aspects. And I was just thinking back as to how our indicators had changed over the last few months. When we started off, we looked at the preventative measures, which we looked at the ports, which was the surveillance and the screening. We had not established our full port health system that is there now with the erection of the port. So we were planning the erection of the port. We were looking at preparation of the officers at the port as to what we put. Do we put temperature, the temperature devices at the ports? What do we look for? How we handle people coming in? And that was just one aspect that we had to prepare. When you look at our health services, we had to quickly do training and education for our healthcare workers. We had to put protocols in place to manage cases coming in and to manage their contacts. So we now had to put all of this together, put new protocols at all of our healthcare facilities, train both the public and the private sector teams at the facilities, set up our respiratory clinics as well. We had to also do the equipment of supplies, protective equipment, the PPEs, and all of what we need to be able to manage the cases in country. We started off, for example, with the use of our isolation and quarantine facilities. We started off with just a capacity of 50 using small guest houses because the impact was a lot less. And when I think back to this extending to almost 500 at one point to be able to manage the number of persons, both returning nationals and otherwise coming in at one point. So when I think of where we are now and I go through throughout the months how our system has changed to be able to manage, and even the care where when we started having cases, we saw the urgency of developing our respiratory hospital. So it meant the move from Victoria Hospital to the Owen King Hospital to allow us to have the necessary space to manage our COVID-19 patients in an isolated zone. So there is so much that has gone into the management and care, and the Ministry of Health from the beginning, all of our teams from the various departments, our epidemiology department, our environmental health department took on a role that they don't traditionally do. They were very supportive in putting protocols, for example, for business places. Generally, their mandate is for food establishments. So we now had to have special protocols for business places, for supermarkets, and to put for every single sector, putting those protocols, finalizing it, doing the reviews to ensure that we reduce transmission and to keep the country safe at that time. Our clinical teams as well, we now had to share our workload from what we regularly do in keeping our regular patients well, and also now managing COVID-19 and keeping them safe as well. And another huge capacity in the beginning, we within the Ministry of Health, we did not have the capacity for testing for COVID-19. So all of our samples went over to the Caribbean Public Health Agency for testing, and there was a significant delay in getting the results. And one of the huge milestones I think that we have done is to develop PCR testing within the Ezra Long Lab. So when I look at where we were in our capacities at the beginning, it did not just allow us to manage COVID-19, but any other outbreak that may come later on.
Okay, Dr. George, if we could speak about the quarantine-based, the facility-based quarantine sites as well as the hospital. But first, the hospital. Speak to us about the transition. We definitely know it was expedited between March into April. The effort to really have a respiratory hospital going to deal primarily with COVID-19 patients. Speak to us about that transition.
Yes. Initially, as you're aware, we only had all of our main public hospital was the Victoria Hospital. But in our plan, knowing that we already had a shortage of beds at the Victoria Hospital, we realized that we needed more space. In the very beginning, we used the chest wing, which was a 12-bed institution. And that is where we managed our first set of patients, or our suspect cases were housed. But we were aware that if we were to get cases in St. Lucia, we would need a lot more beds than that, judging from what we saw in the other countries. So the recommendation which came out of the Ministry of Health was to expedite the move over to the Owen King Hospital, so that we can now retrofit and prepare the respiratory hospital for the management of cases. And through the World Bank, the hospital was renovated and retrofitted into a respiratory hospital with all of the necessary systems to allow the safe management of patients with infectious disease. So at this point, I think the total capacity is 164, about that. At present, although we have at present about 50-something patients at this point, but we do have the capacity, if needed, to be able to manage over 100 positive cases at any one time.
Okay, and the quarantine sites as well. Speak to us about that. We know that it's been opened and then closed and reopened again. Speak to us about that process during the last 12 months.
Initially, we used about 3 different guest houses to put our suspect cases and our suspect cases and for quarantine, which gave us a capacity, if my memory is correct, of about 50 beds. But as we continued, we worked on the capacity to increase our public health facilities. So we then acquired about 3 hotels with increased capacity for beds instead of using just the guest houses. So we were able to take everyone coming from areas of concern and keep them there for a period of 14 days. Now, the policy of the government has been that the management and care of COVID-19 remains free of charge. So St. Lucians coming in, for example, returning nationals were kept at hotels and given their meals. Everything was the same standard of the hotel, and all of that was funded by the government. Our clinical teams manned those facilities, so we did all of the temperature checks, all of the reviews of those persons until their release, which included transportation at the end of that period. And when we assess our risk back then and we look at where we are now, this was one of the safest modes I think that we had, and it did keep us for several months at a very safe place in the management of COVID. We were able to pick up any positive cases. They kept isolated. We did not have the risk of community spread because those persons were kept in isolation during that period of time. But as you would imagine, the cost of paying for all of those hotels was exorbitant, and it did not remain sustainable. and we moved into a mixed mode where we had less of the hotel space, and we also gave the option now of home quarantine. And I think this was one of the decisions that was made, which led to an increased risk, which we saw over last December. With the increasing numbers of persons coming in on home quarantine, we noted great increases within the communities. And our epidemiology team actually mapped the locations of the home quarantine to the areas where we saw increases in cases within the community. So we think that there was a link, especially given the fact that we managed numerous breaches of persons coming in to home quarantine and not staying in but moving about in the community and all over. So we went back into this mode of using the institutional quarantine, and for those who were not able to stay in, we use a monitoring bracelet and a biointelligence sticker to be able to monitor the vital signs remotely, and also to monitor the movement of such persons remotely as well. So we do get an alert in case they come out of their home. We are able to monitor. But this we are going to be doing some tweaking to that to add some responsibilities for persons with the watch, because we've been getting persons damaging the watch to remove it. So this is one of the things that we are dealing with at that point. But going back to the institutional quarantine has also assisted in reducing the transmission within the community.
Okay, and we have some more questions for you, Dr. George, but first we just want to...
But just one quick question, Dr. George, pertaining that, because we are looking back, and some within the public's mind, the question is whether you, looking back on some of the decisions that you made, do you feel, especially the quarantine, having the returning nationals quarantine at home, would you have taken a different stance? In hindsight, would you have changed your position, knowing what you know now? Would you have taken a more, perhaps, draconian approach to it, a more punitive approach to it? With all that you know now, how would you have handled it back then?
Yes, I'm looking back, because in the management of COVID, we've been doing a number of things. Like I indicated, in the first few months, there was very limited information as to exactly how the virus managed. What are the most effective ways to reduce it? Countries had been seeing outbreaks, but we were still looking for information because it was very limited. It was just coming from how different countries are managing. And one of the things which we do a lot in public health, we would read on all of the measures that various countries take, but one of the things which the public does not always realize, you don't just read a country's measures. It has to be adapted to your own country, your own situation, and the culture of our people. It has to be something that's implementable and something that we can enforce. And one measure which would be extremely successful in one country does not necessarily mean if you put that measure in your country, then it would work. So in the beginning, we were looking at all of the best practices to see what would be most effective. And you also have to look at not just, you don't put a measure in place which may end up giving you more disadvantages. The benefit must always be more than what the possible cost of doing that measure is. So in the decisions that are being made, we take the public health decisions because health and safety has always been the priority throughout the management. It's always been about health and safety. But there's always a need for a balance. In relation to the quarantine and isolation measures, the best practice has always been to keep persons in where they could be monitored, especially given the culture of our people within the communities and the family nature, the community spirit that we see. And especially when in November we were aware of the huge increase of returning nationals who came in. When I think back, we should have limited the number of persons who came in or keep everyone within an institutional quarantine, because persons coming in during the Christmas season, which traditionally we know is a time of festivities where there's a lot of family activity happening, a lot of community activity happening, and it did contribute significantly to our third wave, which we saw. To ask persons to come in realistically during the Christmas time and to think that they were going to stay home for 14 days, it was not realistic. So when we think back of those times and those periods, I mean, we're already planning what we can see around the Easter season based on the lessons learned. So we've had the opportunity to put measures in place, and we've seen what response we get. So we know now, based on our contact tracing, what are the highest risk activities that we have within our own local system. So we know where there is the greatest likelihood of spread. And unfortunately, it's the same sectors who I will say, in inverted commas, suffer all of the times, because their activity is the highest risk. It's where we're seeing the most spread, and it's a social activity. So when you have long holidays where people tend to gather, beach activities, huge activities, almost always afterwards we would get a spike. So in hindsight, I wish we did stick to the institutional quarantine, especially during the festive season of the Christmas time. And I think the rate of increase that we saw, and we actually saw it after 14 days after Christmas and 14 days after New Year's. So our data suggests what was going on during those holidays. So we've learned a lot, and we see the results, we see what works. When you look at the management of the third wave, the measures that we put in place to reduce the spread, our forecasting, where we said that if we use our data using our transmission rate based on the trends, we did anticipate that by mid to the end of March we would see the decrease in cases that we see now. So we are using the science, we're using our data to predict and to make the recommendations on managing the pandemic now. So at this point, we are at a stage where we know what works for the rest of the world, and we also know what works for us locally moving forward.
Thank you so much for that very candid response, Madam CMO, and indeed, lessons learned.
Definitely. But before you leave, we just want to air one news report taking a look back at the transition from VH to the OKEU hospital. When we come back to you, we want to backpedal to the second wave of coronavirus here on island. We know that some of the sectors impacted were education, also tourism. We want to go back to July, the role of the Ministry of Health in response to those. So viewers, just take a look at this migration from the Victoria Hospital to the OKEU. Take a look.
Well, it's now official, and there was no holding back the elation and emotions of staff as they ended one chapter to begin another. Victoria Hospital has officially transitioned to the OKEU Hospital. Even the Minister for Health could not hold back her sense of relief.
I feel elated. I really feel elated today. I went to Victoria Hospital this morning, and I saw the ambulances coming and going, picking up patients, and back and forth, and it was really, really refreshing. It was exciting. It was just I just felt it's almost like you feel liberated that now we are out of Victoria Hospital and we are into our new hospital, our OKEU.
President of the St. Lucia Nurses Association, Alicia Baptiste, said this move left her nurses with bittersweet emotions.
Because most of us were trained at Victoria Hospital, and it is our home for many, many years. So leaving it this morning, for me, it was really, really deja vu. But let me just say on behalf of our nurses that this is a move well overdue.
An energetic and highly motivated staff, decked out in their respective team colors, were busily implementing the action plan. They were first blessed, provided with breakfast, and had a rainbow to guide their day.
You have the different teams, you have the transport team, you have the command teams, and then you have the teams who will be actually moving the patients. So we're very happy this morning and we are ready to go.
We are very happy about this move. At long last, we have waited a long time for it, and we're going to make it work. It will work and things will improve.
With the suspension of elective surgeries and outpatient clinics, VH had its smallest census of patients, with only 45 patients to be transferred to the OKEUH. The move was successfully coordinated via a command and sequencing center manned at the Victoria Hospital, with a sub-command post at the OKEU Hospital.
This is the command center at the Owen King EU Hospital, and what we do here, we are responsible for ensuring that the patients are received safely and triaged to their appropriate ward and bed. So once the patient has left Victoria Hospital, Sister Octave will get a phone call informing her that the patient's left, and we then inform the wards here and the command post when the patient arrives.
So if there are any issues on ground, it is channeled up to us here in the command center, and if there's need for external support from Ministry of Health or other services or agencies, we also contact them externally to come on board to ensure that move is successful.
We determine which patient goes next.
This sequencing center was managed by Nursing Director Ruth Regis Adesanya, who orchestrated the overall move. She said the move was guided by the international criteria for patient move.
So for the past 2 days, we've been doing assessments of all of the patients to be moved and to determine how we sequence them. What we've done is we've ensured that the hospital, whether it's Victoria Hospital or OKUH, is not overwhelmed. So we're only sending out from one unit only one patient at a time, and receiving on any unit one patient at a time.
By 12 noon on the move day, 22 of the 45 patients were already transferred to the OKEU.
It's been going very well. Exactly to plan. I know a lot of persons thought we would be under pressure and look like, we're ready to crumble, and you don't see that at all. So all of the years of planning and training has actually, paid off.
The Owen King EU Hospital has now experienced many firsts, from the first patients in ICU, on the wards and in A&E, the first babies in the special care baby unit, the first surgery, and a proud mother, Daria Peter, gives birth to the OKEU's first bouncing baby boy, Darian Owen Peter. As a mark of respect, nurses lined the hallway at the OKEU to show respect to Sister Ruth Regis Adesanya for her remarkable leadership in planning and executing the successful transitioning effort. Reporting for the Ministry of Health and Wellness, I am Glenn Simon.
That was Glenn Simon doing that report on the transition from the Victoria Hospital to the OKEU Hospital, of course, to accommodate the establishment of the respiratory facility there for COVID-19 patients. Dr. George, thank you for staying on board with us. Today being the anniversary of the first case of COVID-19, of course it was an imported case of COVID-19 here on Ireland. Can you speak to us about that particular case? I know we remember when the announcement was made and of course the subsequent actions taken by the government of St. Lucia. Take us back to that time.
I don't have the report of all of the details, but I remember that first case who came in. I think this was the lady who came in as part of the cricket group, and she had traveled to another island before coming in. So we had to do extensive contact tracing for all of the places that she went to, and all of the people that she came into contact with during that period of time. And one of the things which we had to deal with, which we no longer have to deal with, is the fact that we had to send her test overseas. We had to send her sample overseas for testing. So she was managed. She was a very mild case at the time, so we were able to manage her without incident. And we did, as far as I know, we did not get any other positive cases coming from her at the time. We did note a level of panic from the public when that first case came in. And it was almost a time when everybody now took us a lot more serious with a lot of the training that we were doing with the various. And it was also a time when we quite quickly implemented a lot of the measures, the very stringent measures from very early to try to contain and reduce with our first set of cases that we noted.
Okay, now that we've covered that ground, I want to go back to VH, the rehabilitation of there. You spoke briefly on that. I just want to go to a quick clip of the upgrade of VH to the respiratory hospital before we wrap up with you.
Since the transitioning of the Victoria Hospital, VH, to the Owen King EU Hospital on March 27, 2020, work has been ongoing in transforming the facility into a respiratory medical center. Converting VH has come at a significant cost that was unforeseen, much like the novel coronavirus. Nevertheless, Health Minister Senator Honorable Mary Isaac says government is committed to completing the respiratory hospital as it plays a major role in the island's efforts at combating COVID-19.
You know, we did not have a budget for that, so we had to find the funds within, you know, within the budget of the Ministry of Health, as well as funding from the Ministry of Finance. And it is coming along really, really very beautifully. The inside is almost done, you know, almost complete.
Meticulous details have gone into the rehabilitation works with safety at the forefront. The Executive Director of the OKEU VH, Nancy Francis, explains the scope of works.
So we have on ground our hospital engineer who's working very closely with Skelly Construction, as well as the oversight committee from the World Bank. So on a daily basis, our project engineer will be in contact with Skelly Construction so they can look at the logistics for the day. And from a management perspective, every single day we have a manager on ground at the respiratory hospital to ensure that things are done, things are coordinated in the right way, and we are able to respond to any emergencies that may arise.
With the onset of COVID-19, plans by the Ministry of Health to utilize the Victoria Hospital as a polyclinic following the opening of the OKEU have been on pause.
Well, it was supposed to be a polyclinic to replace the Chaussee Road Health Center. But for now, we can only go as far as saying that it is going to be a respiratory hospital. And because of all the monies, all the funding that is going into transferring it into that facility, I am not sure what we are going to do from there. Hopefully, it probably will be in a better position, in a better place, in a better situation for us to change it into a polyclinic. But for now, I am not sure. I cannot say. We have not looked at that past COVID.
Minister Isaac estimates that the respiratory hospital will be fully functional by the end of September. 5 respiratory clinics have also been set up at the Grosley Polyclinic, the Clary Wellness Center, the Dennery Hospital, the VA4 Wellness Center, and the Soufrière Hospital. The services at Dennery and Soufrière Hospitals and the Leclerc and VA4 Wellness Centers are available daily, Monday to Friday, from 8 a.m. to 4 p.m. Grosley Polyclinic is available daily from 8 a.m. to 4 p.m., including weekends. The St. Jude Hospital can also be accessed by persons with flu-like symptoms. From the Government Information Service, Lisa Joseph reporting.
And that was a report on the rehabilitation of the VH. Of course, much work has gone into that facility to ensure that it is equipped for accommodating the COVID-19 patients. Dr. George, before we wrap up with you in this first instance for our program, before you leave, you could just speak on the Cuban brigade that came to St. Lucia. We did have help on many fronts, but I think this was one of the most significant in terms of personnel being lent to our team, our healthcare sector here on island.
Yes, it was. It was a significant part of the augmentation of our human resource to manage COVID-19 in country. With the setup of the Victoria Hospital, and this was done in collaboration with the World Bank. If you're aware, once the World Bank is funding a project, it has to be done to a certain standard. So a lot of the delays that were associated with the finalization of the hospital had to do with the requirements for managing respiratory illness in any center. So all of us know V8, we've been there, we know that it's set up in a lot of open wards, but for managing infectious disease, there were certain standards that the World Bank insisted had to be in place. The separate rooms, the size of the hallways, the airflow, and so it was a lot of detail that was put in. And for persons who've been there, they know it's now a lot of single rooms with sliding doors. So, and the setup of single rooms for a healthcare facility instead of open wards, the human resource requirement to man it was also a lot more. And given that our staffing complement have now moved over to the Owen King EU Hospital, and we had set up 5 new respiratory clinics around the island, it now became necessary for an increase in staffing. And we know the shortage of nurses that we have here, and our physicians as well, even on a normal basis. So now with preparing for COVID-19 and the level of supervision that the patients need, since a lot of those are patients who are in respiratory distress, there was an urgent need to increase the staffing numbers. And the government of Cuba, that we're always very, very grateful for, because even before the COVID situation, they provide us with specialists that we don't have on island. When we reached out to them for the extra staff to assist, they were very grateful to put those numbers together and to send them over. So we were extremely elated to get the nurses and the physicians, especially for the ICU care of the respiratory hospital, and the internists that were needed to supervise those at the respiratory hospital. So we've had some of the physicians within our community respiratory clinics, and the nurses as well, and at the respiratory hospital. So we were extremely grateful to receive them and to incorporate them into our system of care. And we still have, although less, I think at this point we have about 87 working with us at the various sites.
Thank you very much, Dr. George, for that. We do look forward to hearing from you later on in the program.
Thank you very much, and thanks for having me.
We get an affirmative on hearing from you again in the program later on.
Later on.
Yes, I will join about after 1 o'clock. I will join again for the end piece. Thank you.
Wonderful. Thank you very much. And now to a clip just coming off of our talk about the Cuban Brigade coming to St. Lucia, a clip on the Ministry of External Affairs, the welcome that was given to the team coming into St. Lucia.
When Cubans come to help, they don't just come to give up their skills. They don't just come to give up their expertise. You come to give up yourselves. Because you're giving from the little that you have, not from the excess that you have. You're here not because there is not a need in your own country. You have as great a need as we have. But you've left your homes, you've left your families. You've come as soldiers on a battlefield to fight a war, and you've come prepared. You've come dressed for battle. And we want to thank you for that.
And of course, there the Cuban Brigade coming and the Ministry of External Affairs welcoming them. Of course, we are eternally grateful, the government and people of St. Lucia, for the help that Cuba has given and continues to give. And this is just part of a bigger effort, humanitarian effort, and help from many of the friendly nations. You know, Taiwan, the country of Taiwan has helped as well, as in our region as well. We have many of the other islands, all of them standing in solidarity, assisting one another right up until this vaccination campaign. We did have, I just want to go to the shutdown at this point in time in our update to the nation. Lisa,
before we get to that, we wanted to go back to March 13, 2020, when we had our first registered case, and we want to get some. Let's refresh our memories of what that was like and the details of that first case. So we go to the press conference held back then, giving us information on our first case.
Today, Friday, March 13th, 2020, St. Lucia recorded its first confirmed case of COVID-19. The patient is a 63-year-old woman with a travel history from the United Kingdom, which has reported a total of 323 confirmed cases of COVID-19 to date, with active community transmission. The patient arrived in St. Lucia on March 7th in the company of her husband and presented to our healthcare system on March 11, 2020. A clinical sample was taken from the patient on that same day and was sent to the Caribbean Public Health Agency for testing. The results were received today, Friday, March 13th, this afternoon, and confirmed that it is our first case of COVID-19 here in St. Lucia. She has been placed in isolation at a medical facility as per established protocol for management of the cases of the virus. As a result of her travel history of significance and the symptoms, health practitioners are currently undertaking the required contact tracing and quarantine of her contacts who have to this time not displayed any signs and symptoms of the virus to date. The Ministry of Health, we shall be providing further updates as the relevant information becomes available.
I recognize that this situation is one which we all hoped would not have occurred, but one which we have been planning for over the past few months. My team at the Ministry has been preparing for this likelihood, and we have now activated our teams to support the management of this case. As the Minister of Health, I can assure you, the public, that I am confident that all is being done to ensure the health and safety of this patient, our health practitioners, and the public, and their health is foremost in everything that is being done at this moment.
And a look back there at what the situation was with our first case, that announcement, the details coming from the CMO, and of course the reassurances there by Minister Honorable Mary Isaac in that respect. We're going to take a very quick break. When we come back, we'll be diving a little bit deeper from March into April, what obtained then. Stay with us. This is the GIS NTN COVID-19 Year in Review.
It's here, the Intellisense Bio Button, an innovation to the Ministry of Health's approach in battling COVID-19. The Bio Button is a state-of-the-art device. It supports people keeping regular checks of signs of possible COVID-19 infection while placed in home quarantine. It monitors temperature, heart rate, and respiratory rate. It is very simple. Just link it to your smartphone and place the button on your chest. It's that easy. The Bio Button costs only $100 US for the 14-day period. For further information, please contact the Epidemiology Unit at 468-5325 or 468-5324.
And thank you so much for staying with us. And we would have known that coming off our first case, March 13, 2020, of COVID-19, we accelerated all of our protocols. And as we moved into that, going into April, we had the shutdown. And I know a lot of us would have remembered that. For many of us here in St. Lucia, it would have been our first experience having to have a state of emergency instituted, going into a 24-hour lockdown of the country. And of course, it was really because we did not know the extent of what we were dealing with the novel coronavirus, as the word novel would suggest. It was new. And so we didn't know much, as we heard the CMO say earlier. There wasn't very much known at the time. So we now want to go and refresh your memory on the closure that we experienced in St. Lucia. So we had border closures, we had a 24-hour lockdown here in St. Lucia, and we also had curfew that was instituted. So let's refresh in our memories and go back to that clip.
But we will not be allowing any individuals to arrive into St. Lucia. Now that's whether they're from the Caribbean, whether they're from the United States of America, or wherever else we have flights from. The only exception would be, like for instance the Cuban doctors, an exemption we made for them. But if an exemption is required, you need to write to the chief medical officer specifically in order to get her authority for any dispensation from that policy position. Tonight, we're also going to see the introduction of a curfew, which will start from 11 o'clock in the night to 5 o'clock in the morning. Again, I'm appealing to all St. Lucians. Let's work collectively together to enforce this curfew. Let's not be that the police officers have to be around reminding us to do something to protect ourselves.
And that was Prime Minister Honorable Alan Chastney then speaking to border closures, appealing for all St. Lucians to come on board and to really give that national fight against the coronavirus. But apart from our international borders being closed, we also had the institution of local borders. We had the 758, 759, Jesse, if you remember, that's our very internal border. And I remember that experience. Certainly we even had the memes going around. We had individuals who had created anthems, if you will, so that we had the 758 anthem, the 759 anthem. And it was also very painstaking time on the socio-economic front, because then with these internal borders, we had a lot of the vendors coming from the Choiseul area and so forth, who would normally have to come up to Castries. They were finding difficulty at the time being able to come and ply their trade. Of course, as we went along, adjustments were made to be able to accommodate the vendors. So it was a very trying time, and of course, really because it was also new to us. We'll be able to dive a little bit deeper into the whole thinking behind the decision then when we speak with the Commissioner of Police, Milton Daisy, in the next few minutes. Your experience on the 758, 759 border closure?
Well, I didn't have a personal experience because I stayed in my section, I stayed in my lane. But definitely it was part of, you know, something that many St. Lucians had to get used to. You indicated, you know, the pandemic and the measures that were instituted well ahead of the national shutdown that we saw taking effect on the 1st of April. The Prime Minister did indicate ahead of time that he would be introducing, you know, social distancing measures, and we also saw the suspension of non-essential commercial activity, you know, being imposed from 23rd March. So that's well ahead of the national shutdown, which took effect on the 1st. But you know, I want to focus on the 1st when, you know, things just came to a standstill in an effort for us to for the government, the officials to manage COVID-19 best as they could in what was the first wave, essentially, of the pandemic. Many persons, you know, and I want to bring in, you know, the importance of NTN. All eyes were glued on NTN for the way forward. Persons wanted to know, well, can I go to the supermarket? Can I go to the gas station? And initially, it was a no. Everywhere is closed. Everyone should remain home. And of course, we did see the Prime Minister letting up a bit, giving persons the opportunity if they needed to purchase gas, some items. Of course, we know that NEMO also kicked into high gear in the provision of food supplies for individuals. But it was definitely a time of uncertainty for the population overall, and you could feel it in the air. You could feel persons not knowing where to turn, and at that time, the advice coming from the NTN was very critical in that respect. Looking at the curfew, we had the curfew being imposed from 11 p.m. to 5 a.m. And on March 29th, the Prime Minister extended the shutdown to April 14th and extended the curfew from 8 p.m. to 5 a.m. So it was definitely a time of adjustment. If the Prime Minister we have protocols right now, but if we were under a similar stringent conditions at this point in time, we would have been, sufficiently used to it. But then it was something very new to the populations all over the world, and it did weigh on, as you indicated, not only the psyche but the socio-economic aspect of things. 23rd March was our first declaration of a state of emergency with respect to this pandemic, and we had the announcement of the closure of our country's airports. But prior to that, so we did hear from the CMO about the restrictions. We had border restrictions well ahead of that in terms of restricting certain from countries in the Orient, but prior to that, it was just restricted to that, and we had the closure of the borders. Of course, many St. Lucians in the diaspora, St. Lucians studying abroad, wanting to know what is going on. It did cause a bit of upheaval, but that decisive action had to be taken in order to stop COVID-19 in its tracks. And for much of the year, Lisa, we did enjoy relatively low rates of transmission. Many of the cases were imported. And, to the credit of the Ministry of Health and the healthcare sector, first responders, it was definitely something that was managed well by and large. We were the envy of the region and the world for quite some time, up until, I would say, us coming into the second wave of the coronavirus in September, October, thereabouts, when we had that 29th case of COVID, confirming, community spread.
And once we had that, then it was really that the horses had bolted out of that barnyard. So it was the time when I think that St. Lucians began to really think differently. It also really ramped up the sort of pressure that our healthcare workers were coming under. And that adjustment period as well, Jesse, that you were referring to, also extended itself to our health institutions, because I remember being hospitalized at that particular time, and it was a difficulty for persons coming for hospital visits, because then everything, so it's an indication that everything had to be adjusted in our lives because of COVID-19, and so no longer were family members able to come and have the usual 3 visits per day. It had really gone down to 2 visits, just the morning and the afternoon, and it had been reduced to only half hour, and the number of people visiting also went down. So you had people who were coming to the hospital and wanting to see their family members, and no, I'm sorry, you can't. And of course you would hear that reaction to not being able to go in. It was just a clear indication from my hospital bed that St. Lucia had been changed forever because of COVID-19.
Absolutely. And one of the outstanding aspects to take a look at is the suspension of liquor licenses. That was definitely something on the minds of persons. The first move by the government of St. Lucia was 29th March. And outside of religious observance, alcohol was really free for all. And we saw on 29th March the banning of the sale of alcoholic beverages, as well as the suspension of liquor licenses and the closing of all bars. And at a time of uncertainty, that's something that comes into quite a bit of contention.
Yeah, and it wasn't unique to St. Lucia either, because we found that countries, even in the great United States, bars were being closed. Over in Europe, bars, because the understanding is, and the CMO made that point earlier, that COVID-19 is really driven on a social end. It needs human beings in order for it to continue to live in effect. And so the decision to close the bars in order to simply limit the avenues by which person would be able to socialize. And it was not well received. Although I think the majority of St. Lucians understood then the thinking behind it, but there were pockets of disagreement. I think that these pockets of disagreement grew and grew once we had to institute that measure more than this initial period. So, and of course, you know, in the public domain, it has raised so many questions about our consumption of alcohol, our relationship with alcohol, the role that alcohol plays in our lives, and that sort of thing. So lots of questions, COVID-19, and I think I always keep saying that COVID-19 has simply revealed so much about human beings, about the world, what it is that we take for granted, and what it is that we hold so dear to us. So for us, COVID-19 again has forever changed how we will be able to live our lives.
Absolutely. Still taking a look at the initial response and statements being made by the Prime Minister on the 24-hour curfew, which was made on the evening of March 31st. We saw that, well, many persons were caught off guard for the most part, and so April 1st was a frantic situation for many individuals, and it was based on that the Prime Minister indicated that some space would be provided to persons to go get supplies at the bakeries and gas stations, the mini marts, open for a limited time to allow persons to just stock up on items for that week. That the COVID-19 situation was really starting to flesh out on Ireland. Of course, we saw April 2nd, St. Lucians queuing up on long lines, you know, defeating the purpose really. I remember that quite clearly in the city, but, you know, taking long lines outside, you know, the briefly opened shops, mostly ignoring the Prime Minister's appeal for social distancing. Later on in that week, we would see the reversion going back to the 10-hour curfew. So it went from a 24-hour curfew to a 10-hour curfew from 7 p.m. to 5 a.m. From 7th April all the way through to 13th April, and essential businesses would be the only ones allowed to operate from 7 a.m. to 4 p.m. except during that Easter weekend. That's Good Friday, Easter, and Easter Monday holidays. So from the get-go, St. Lucians have been, you know, by and large, guided by the government of St. Lucia in terms of this COVID-19 situation all the way up to now. What we're going to do is take a quick break at this point, and speaking on behavior, we'll be hearing from the Commissioner of Police, Milton Daisy, on the measures instituted by his office to guide enforcement of the protocols.
Virus, ready to harm us. Panic is not the answer. We can win this together. Often use hand sanitizer, better yet use soap and water.
We must protect each other if we are to beat this corona.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. Be a soldier, together we can beat this corona.
So you don't become the next case. Avoid touching your face. I'm sure you've been told so. Handshakes and hugging are a no.
Advice, give you the please. Cover your mouth and your nose if you cough or sneeze.
Practice social distancing and avoid large social gatherings.
Together let us win this war. Be a soldier for St. Lucia. Together let us win this war. St. Lucia, be a soldier. Together we can beat this corona.
For further information, please contact the hotline at 311 or the Bureau of Health Education at 468-5349.
And welcome back to our year in review, looking back at COVID-19 as we go through the various months. Before we took the break, we were looking at the measures that came into effect as the shutdown was announced and the state of emergency instituted in St. Lucia. Jesse, when you left off, we were just looking at some of the restrictions that were in place.
Absolutely, in the initial phase. And, you know, I also want to indicate that we are expecting the Prime Minister to join us later on in the program, and something that we can definitely look forward to speaking to him on is some of the measures that accompanied the immediate actions that were taken on Ireland. So not only did he indicate that we're having, you know, a shutdown to reduce the spread of COVID-19 here on Ireland in the initial instance, but it was also coupled with measures that the government of St. Lucia, that includes the social stabilization program, the plan, on his part to try to keep the economy afloat, because the whole conversation about lives and livelihoods came to the fore when you had the closure of certain businesses and what have you. So that's something that we can look forward to speaking to the Prime Minister on in just a moment.
But you know, Jesse, very early on in the pandemic, looking at the global picture, Prime Minister Chasney had already indicated that COVID-19 was really a battle on two fronts. And that conversation had not been started in the region as yet, and I dare say the world, because the focus was really on the health aspect, as it should rightly be. But looking behind that was the threat that would perhaps be even more devastating, because not everyone would be infected by COVID-19, but certainly everyone is going to feel affected by the financial constraints that COVID-19 has created the world over. And Prime Minister Chasney from the get-go had been saying so. And I think that St. Lucians had perhaps not fully understood back then what the intent of the comments being made. They did not understand the point that was being made, that while we were to focus, yes, on saving lives because it is ultimate, but on the other end of things, people also need to live. You need to be able to earn a living. You need to be able to pay your bills. You need to be able to clothe yourself, feed yourself, take care of your families. And so on that front, that battle is even perhaps more acute than the health aspect.
Absolutely. I mean, we had no idea at the start of April, and we did get the indication from the Prime Minister, but by the end of April, when jobs were now in the balance, we had persons being, you know, thrust on the breadline by the thousands, our lifeline being tourism, being directly impacted by the closure of the borders overall by April. And definitely we've so far seen the reinstatement of many jobs within the tourism sector and others that were affected initially, but still we continue to face, you know, a lot of fallout from this pandemic. So definitely looking forward to speaking to the Prime Minister. Do we have our next interview on air?
We are waiting the Police Commissioner, Milton Daisy. He is online. Thank you so much, Commissioner, for speaking with us on this Saturday, 13th March. It is 1 year on since St. Lucia became affected by COVID-19. Commissioner, you were certainly one of the frontliners at the forefront, being able to lead that law enforcement charge for the island, ensuring that protocols were indeed being adhered to. Can you speak to us about your own experience when you heard that we had received our first case? What were you thinking then?
Yes, actually I was getting information, especially on the news about this disease in the bigger countries like Canada, in the US, and especially Italy. We did not know what it was like, but seeing photographs and so on, videos of persons being affected, it was something that was very, very disturbing to us. And we were just, it's like, when will it be here? We need to prepare for it.
Mr. Daisy, if you could just speak on the first state of emergency that we had with respect to this pandemic, definitely something very unusual, alien for the population at the time? Speak to the challenges that you would have experienced initially in ensuring that the state of emergency was being enforced.
Yes, actually, in preparation for this, we were preparing our plan, response plan, and in the preparation, what we did, I was in communication at the time. I was the acting commissioner, and I was in communication with all the commissioners, especially those from RSS, and we were exchanging ideas at the time as to what needed to be done, what they have done, what and so on, so that we would devise a plan to fight this coronavirus.
What were talk to us about some of the measures that were instituted by the Royal St. Lucia Police Force in that initial instance? I know by now persons get, these persons are now more understanding of the protocols in 2021, but then initially in the various districts, the communities, highways and byways, what was the general response to the enforcement efforts on the part of the force?
Yes, one of the first things that we were doing is to ensure that the protocols were maintained in certain aspects. For example, the wearing of masks and so on. But these protocols were strengthened when we introduced the two zones, the 758 and 759. As we call it, that is one of the zones in the eastern January and one in the west, that's in Canaries area. So we implemented that. Also, what we did, we had to increase the patrols on the sea, because we were getting reports that persons were moving away from Matnik, but when the borders were closed, we were getting persons coming in illegally because, the proximity of Matnik and St. Lucia, it's easy to get a canoe and come into Matnik. So this is one of the things that we did. As another measure, we ensured when we realized that persons were coming in from Matnik, neighboring sometimes St. Vincent, Matnik and St. Vincent, what we did was to have an extraction team, because persons would come and sometimes you get the report because not at all times that the Marine unit were able to get the persons coming in. So we find in doing this, we formed an extraction team, and these teams, what it did was to get those persons and individuals, and of course other persons who the Ministry of Health would have given us an indication that they needed for testing or quarantine, and this extraction team would be going out there to get those individuals.
Just coming from getting persons to wear their masks out in public, particularly the capital and the towns, all the way to the enforcement of heavier protocols like the curfew. Speak about the compliance of the general public initially, all the way up to now.
Yes, I must say that we are getting increased compliance. As persons understood, as we communicated, we were getting increased compliance. However, I must say some sections of the population, some persons who may be doing things that I would say they do not care or they do not observe the protocols. We got some of this, and then we had to respond.
Mr. Daisy, just talking about the introduction of the reinforcements for you. I don't want to get ahead of our program, but I just want to speak a little bit on the introduction of the wardens. Can you talk to us about what that meant for the force in terms of getting some assistance?
Yes, actually, as part of our plan, this is one of the things that we did. Having about 200 wardens sworn in as peace officers to assist with the law enforcement efforts. And even before the wardens, we had to cancel vacation leave of officers who were out there. However, I must indicate that officers were those who had pre-existing conditions were given an opportunity to stay home and so on, because these were directives from Ministry of Health at the time. So we did this. Also, what I did, the band, we because of the pandemic, the band was really just there, not playing anywhere, because there were no functions and so on, and because of the safe distancing protocol. So I called in the band, and they were redeployed to other areas, such as the Marine unit, which at the time needed resources to be out there enforcing the law. We also brought in the reserve police, whom we call the SRP. We brought them in and to assist. So these are some of the measures that we took.
Okay, and with respect to the health sector, we know that the various facilities, for instance, the quarantine facilities, it would be very critical for them to be policed and ensure that security was heavy at those locations. Speak to us about that aspect of things in terms of the quarantine facilities, as well as even the hospitals, in terms of having proper security at those locations to avoid any conflict during this very tense period.
Yes, actually the quarantine area, the first one being Starfish, and we know that when persons were first introduced to there, they had some issue of persons escaping, and we had to come forward and call on them to return. A few returned, I could recall. Persons continued until probably the second batch, where persons were settling down and so on. We had to get officers in all these locations, including the at the hospital and so on. So places where tests were being carried out. So these were things that we implemented to ensure that persons were safe, and that the Ministry of Health would have carried on their functions without much problems.
Thank you so much for that, Commissioner Milton Daisy. I'm sure we'll be touching base with you a little later on. We're going to take a very short break. When we come back, we'll be speaking with St. Lucia's Prime Minister, Honorable Alan Chastney, as we look back on COVID-19 a year on. Stay with us.
What does coronavirus have in common with love? Both are highly contagious. Spread love, not the virus. Like you, COVID-19 loves a lime. Beach, river, or fed. Coronavirus is like these people who track every lime just to invade. The best way to put off invaders? Cancel the lime. Spread love, not the virus. Keep you and your crew corona-free. Live to lime another day.
Together let us win this war. Said we shall be a soldier. Together we can beat this corona.
Coronavirus? But children are safe, no?
Hold up. Children are actually more likely to touch all kinds of surfaces, put their hands on their mouths and their eyes, or sneeze and cough with little thought about hygiene when around others. While children have been seen to recover well from this virus, they can easily spread it to those more at risk, like the elderly or ill persons who have a weaker immune system. Teach the little ones in your care to be little powerhouses of infection prevention. Keep reminding them, wash your hands. Cover your mouth with tissue or your inner elbow when you sneeze and cough. And be sure to praise them when you see them taking these precautions. Our health is in our hands. Together, through simple actions, we can stop the spread of coronavirus. This message was brought to you by the Bureau of Health Education of the Ministry of Health and Wellness.
And thank you so much for staying with us. We're back in studio, and as promised, St. Lucia's Prime Minister Honorable Alan Chastney is with us as we look back at COVID-19. It's an opportunity for us to really get a thorough understanding of the thinking behind some of the decisions that were made, how difficult those decisions were to actually have to come out and announce and to have them executed as well. As they say, PM, everything is clearer in hindsight. That's what they say. And I think for COVID-19 as well, as you go through the motions and time elapses, then things become a little clearer, because then you begin to understand, well, had we not done XYZ at that particular point, perhaps we'd have had a different outcome where we are at. Whether it is with the shutdown, whether it be with curfews or the state of emergency announcements, but certainly the overall thinking was always to keep St. Lucia safe. Is it not?
Absolutely. You know, for me, as early as mid-February, you could see a certain course taking place that was going to become inevitable. So even in January, when we had the first impact here, which is really the cruise industry, you know, and we had passengers who were showing symptoms on the boat, on the ship, and immediately there were thoughts and impressions that the entire ship was contaminated, and we did not know a lot about COVID. And I would say to you that there was this initial fear because of what we saw taking place in China, then when we saw taking place in Italy, and eventually in London, and then eventually in New York. And I think it's the horrific scenes of the body bags and the containers of dead bodies, health systems that were being absolutely overwhelmed. And certainly amidst the social media, where things tend to get exaggerated and unconfirmed, it made it even seem that it was worse. But I found myself in a very fortunate position that one, my experience in event management, which dates back to the St. Lucia Jazz Festival, followed by the Air Jamaica Jazz and Blues Festival, and then coming back here and the multitude of different events that we took on. So event management is really great because it helps you prepare for the worst. And so you start learning to control the things that you can control and leaving time for eventually the things that you know that are going to happen. My experience at Air Jamaica, and particularly during 9/11, helped me a lot because I certainly was able to envisage a period in which no planes would be flying and the hotels would be closed. And I have to say to you that even in speaking to my colleagues in the region and very senior technical people in the region, even globally, there was something that nobody could really envisage. Come on, Alan, that's an exaggeration. And I was sitting there going, no, this will get to the point like it did with 9/11. The third thing was my experience in the financial crisis, so understanding what the economic fallout was going to be. And then the last thing really was our experience with climate change. And that climate change experience, particularly dealing with the international financial institutions, where we've been going for years to the IMF, the World Bank, the OECD, several different organizations, with a very clear humanitarian justification for change, and there wasn't. So I say that because it told me...
And that's change for the access of financing.
Right. So, you know, being measured by your per capita GDP in terms of access of concessionary funds, that even after horrific hurricanes, Maria and Ivan, and even the one in the Bahamas in 2019, I think it was, There was no rush of aid. There was some, I don't want to diminish or demean anybody, but token help to literally help you recover immediately. But the losses, you know, these were long, drawn-out conversations. And so what did all of this tell me is that we could not sit here and wait for the benevolence or the empathy of other countries around the world if we were going to be impacted. And certainly what was clear was that this was going to have a global impact. And so some countries that you would have normally waited to get some assistance from, they themselves would have been bogged down and otherwise trying to fend off and defend themselves. And so it is the combination of those things that caused us to get to work very early. And so many of long hours of conversations with the governor of the central bank, many of discussions and conference calls with the banking association here in preparing them, because I was terrified that if the hotels shut down, if staff were sent home, what's going to happen to mortgages, what's going to happen to the banking institution itself. Because when we had the financial crisis, and I was the Minister of Tourism, we'd had meetings with the Banking Association. And to understand that almost 80% of their loans are tied back to tourism. So initially they thought it was only 50%. But then when you start taking into consideration taxi drivers' loans, their home mortgages, because the only income they have would be from tourism, flower shops, tour companies, senior management, that if all of a sudden there wasn't a job in the hotel sector, where were they going to now find that replacement job at that salary level? So all of a sudden the bank starts going, oh my God. So I have to say to you that's where I'm saying to you, the experiences, we knew we'd already crossed certain thresholds in discussions. And so it was to say to the banks, and I'm very happy that they agreed with me, and that's why I'm so grateful to the local banking association here, Ms. Mangal, and all of them, that they understood that this idea of doing this thing on a piecemeal basis, of dealing with each customer and giving them a moratorium separately, that wasn't going to work, because there were just going to be too many people coming to the door at the same time. And it was those conversations with the governor of the central bank and the conversations with our banking association that when the signal came that everything was being shut down, and they now started realizing, okay, what Alan was saying is now coming.
This is going to happen.
It's going to happen. That it was the Solution Banking Association that supported the governor and caused not only for the banks here to offer a blanket moratorium, but also led the way in the region and getting the rest of the banks to do the same thing. So that was really the first big thing that was happening. Our experience with the cruise lines helped us with our conversations that would be coming up with the airlines. And again, I remember many of a call with the airline industry. There was one airline in particular, I think we were on the call for almost 3.5 hours going through it. And you could see that they knew what I was saying was right, but they just didn't want to believe it. And I was saying, look, like 9/11, you're going to get shut down. How are we going to reopen? And I gave the example of prior to 9/11, there was no security features. Post 9/11, we went to the ridiculous exaggeration where they wouldn't even allow you to have a plastic knife and fork.
Yeah.
It was a plastic spoon that you used to have. And all the processes changed. And it was to understand that the processes now for travel because of a viral disease would change. So we knew for sure, and I know for sure, that post-COVID, the sanitization of public spaces will never go back to what it was before. And we have to think about it. You know, a plane arrives, people go on and collect some garbage, fluff up the pillow, and that was cleaning. Now you're talking about having to wipe everything down, spray everything out, and full sanitization of planes. Tours that you go on, where there's lots of people going through a facility, there will be constant sanitizing. Think of, you know, when you used to go to Disney World. the people getting in all the different chairs multiple times in a day, different people. Now, after each ride, it's sanitized. So that's not going to change. And then the question became, what is it we were going to need to convince people to travel? And that's why St. Lucia from early had adopted this idea of coexisting with COVID. And I think that was singularly the most important mindset that we had going into COVID, was that we could not afford to shut down. Now, when we shut down in April, in a large part, unknown, nobody really knew how to fend off COVID. Everybody thought that mask might work, because you remember the WHO took a while to endorse the wearing of masks, because there was all kinds of contradicting information. And so it was not until later that people started realizing, okay, wearing the mask, hand sanitizing, and social distancing really can work. And you have to be extremely disciplined in that. And that was just a very difficult thing for the West. The East part of the world, Asia, were much more embracing of those concepts because they already had battled SARS. And we were threatened with SARS, but SARS was never really prominent in this part of the world. And so therefore, persons were much quicker to adopt and adapt to those protocols very, very quickly. So I just want to say that those early days, in the absence of real information, understanding what the protocols would have to be, understanding that many decisions would be made outside of St. Lucia. So the decision to shut down the countries, so once European countries and Canada put in a policy that persons had to be tested on the way home, that automatically, or going to quarantine on the way home, that automatically shut down the airlines. So that was not a decision that we made. That was a decision we had to adapt to. And so shutting down in April, in a large part, was forced upon us, and certainly also the unknown. And as was being said, that the idea of protecting lives was really prominent and eminent in our minds. And I want to explain that, because it's very important to understand what our mindset was. Our mindset really was that the country was not ready for an outbreak. We didn't have enough PPEs here on island. We did not have a respiratory hospital. We didn't have enough ventilators. We did not have enough ICU facilities, and we certainly didn't have enough medicine.
And that was at the very beginning.
In the very beginning. You know, and I'm just saying to you, that's really what was put into the formula to make the decision. And so therefore, stopping any kind of outbreak became job number one, right? We just could not afford any significant outbreak. And I'm really very proud of what we achieved as a country, all of us, because we now know one person can't do this by themselves. It required all of us. And that we were able to immediately contain the cases that were on island. We made sure that there was no breach in the protocols. And up until October, that we'd only had 28 cases. We had no deaths. We didn't have any run on our hospital facilities. And we had reopened our economy. So it means that we were going to restaurants, people were going to church services, we were interacting. And so for the most part, some of the liberties that we'd come so accustomed to that we had. And that while we were able to help support persons who were immediately affected with their jobs, we started seeing now a recovery in the economy.
And that would have come through the social stabilization program, where we had the National Insurance Corporation coming in. We had the economic recovery program coming on stream as well as the income support program. We had the moratoriums, as you mentioned earlier, and of course the barrel concessions. We'll get to the barrel concessions in just a moment. Let's talk about the NIC and its role in that very recovery that you spoke of. Because I think up until now, the thinking is, the general public thinking is that the NIC is poorer because of that decision to have it participate in the social stabilization?
So again, something that's coming out of COVID, and I say very clearly that there are examples of directions we were going in, and COVID now has reinforced the need to move in that direction, but added a sense of urgency to it. Healthcare insurance. You know, the time has come. Can't be that persons are not able to go to see a general practitioner, not able to get basic prescriptions because they just can't afford it. And so we need a healthcare insurance. We need to have unemployment insurance. It's got to be that persons are making a partial contribution along with the government or the private sector company, the same way as you would do for NIC. So where we have contributions we need for pension, we need to have unemployment insurance. And because there was no unemployment insurance, when I met with Mr. Isaac and his team, indicated to him, is there anything that we think that we can do? And luckily for us, we had just gone through a review of NIC in terms of the recommendation as to what some new policies would have to be to extend the life of NIC. So NIC right now is currently funded to end, I think it's 2050. And if we want to extend that, one of two things or a combination of things have to take place. One, either the amount that we're contributing has to be increased, or two, the pension age has to be changed. Or some combination too. I mean, there's no magic formula of this. And so the NIC came back to me and said, okay, PM, given the circumstances, we asked ourselves the question, instead of it ending in 2050, what happens if it ends in 2049? Understanding that there would have to be some policy initiatives to extend NIC onwards. And when they did that, they said, okay, if they ended it in 2049, we would have about $100 million. So it meant that there was the opportunity, and that's the trade-off. The trade-off became, instead of it ending in 2050, it now is going to end in 2049. And we certainly have enough time to implement the policy recommendations that were being made by the actuaries as to how we should survive NIC. So there is no immediate impact on persons' pensions or in hurting anyone. And when you weigh off losing 1 year of the fund versus what the need was at the time, where you had thousands of hotel workers and persons who were affiliated to the hotel industry losing their job with absolutely no idea as to when they were going to be rehired, and giving them some hope was really paramount at the time. And so I'm always going to be grateful to the NIC for helping us execute that. And I know that it was a difficult time because people would have been concerned, but certainly the NIC board, along with cabinet, would not have made that decision lightly and would never have undermined the viability of NIC if that was the case. But we felt that what was being offered, how it was being executed, that was a fair trade-off at the particular time.
And so I think that the general question from the public is, why did the government not have its own money, quote unquote, its own money to give to those who became unemployed?
Mm-hmm. Well, I'm glad you brought that up because, you know, this has been a vexing issue for me for a long time. And we've spoken about it. And probably a fundamental difference between the two political parties. Our party believes that we need to have a sovereign fund, believes we have to have a sink fund. So even Sir John, you know, was very adamant that when you borrowed money, that you would keep setting money aside every single year to pay off that debt. The former government has a different philosophy. They just keep rolling over the existing debt. And we've seen the stories as to them not being able to borrow any medium-term to long-term funds. And all they were doing now was borrowing short-term monies to pay for projects. So when you have, 40% of your debt rolling over every 120 days, that's difficult. So one, The cost of that money is much higher because people think of it only as an interest rate, but the fact is that there's a fee that you pay every time it's turned over. So the net effective interest rate is actually much higher than people think it is. And it puts you under pressure as a government because it means every 120 days people are reviewing your policies and the viability of a country. So you're really on a tense moment. We believed, and we started from the time we came in, to rebuild the sink fund. So when we increased the airport tax, $25 of the $98 goes to SLASPA for their operating cost. $35 of the $98 goes into a lockbox to fund the airport. And then the remaining amount of money was going into a sink fund and also to support some of our other expenses. So we had already built up almost $22 million into this sink fund. And every year we were adding another $12 million to that sink fund. So that was, I think, a very good idea. Coming out of COVID, I can tell you, and coming out of climate change, in terms of dealing with what we call exogenous shocks, so whether it's a hurricane, whether it's a financial crisis, now it's a global pandemic, the only solution for small island developing states, in my humble opinion, is to have a reserve of funds, almost 50% of your budget for the year. So our budget for the year is about $1 billion. So you're talking about you need to have a reserve funds of about $500 million. So if you take Trinidad and Tobago, they have a reserve fund of $8 billion US built up from oil. Mm-hmm. So in many instances when they were short on salaries or short on payments, they drew down on this fund. And the advantage of that is that you're not incurring debt. So not many countries around the Caribbean were in that position. So Jamaica, coming out of the IMF restructuring program, were forced to reserve to put monies aside, so they were able to draw down on those monies. St. Kitts and Nevis, people forget that St. Kitts and Nevis CIP program began in the late 80s. Mm-hmm. Okay, I mean, so you're talking about 12,000 persons who've received passport citizenship in St. Kitts, and that itself becomes a marketing tool. So people have been accustomed to dealing with that program. St. Lucia's program is brand new. So we're not even close to the numbers that St. Kitts is getting, nor Dominica, because Dominica started in 1991. And so that program has also had a huge turnover that they've benefited from. And
so basically they have that reserve due to those programs?
Well, they have some reserve, and that their program continued to sell. So that revenue was not affected. So when you think of it in terms of when COVID came in, what was the revenue that was impacted? What caused the revenue in St. Lucia's tax revenue to fall so significantly? Tourism, no tourist coming in. But your manufacturing sector stayed in, your financial services pretty much stayed intact. We saw in the ICT sector that all of a sudden there was new demand coming out of that sector. But there were significant fall-offs in tourism. And so therefore, we got hurt. Now, St. Lucia's GDP, if you remember, was rebased. Yeah. That rebasing was on the premise that the formula that was being used was not adequately capturing the impact of tourism. And so tourism's impact was increased, the GDP grew, but it also meant that we were much more dependent on tourism than we had originally thought that we were. The other OECS countries have not gone through that exercise and are about to go through that exercise. So when you're going to see the GDP numbers in comparison, it's not apples to apples anymore. So it's going to appear that St. Lucia's GDP collapse or contraction is greater. But that is the major problem. So our major income source, and we were in the midst of a restructuring program of our own, caught us where we did not have those reserves. But where we were very lucky, Melissa, is that the relationship that we had developed with the World Bank and the IMF, the program that we were doing with the delivery unit, where we created a midterm strategy, and we had a team that were helping us to execute that particular program. and the success that we'd had. So what we saw is that government revenues had increased quite significantly. We had been able to bring down the debt to GDP even more significantly. Unemployment was on the way down leading into COVID, so there was some fiscal space. And as a result of that, we were able to borrow monies from the IFIs, the World Bank, CDB, the IMF, and also from the Taiwanese. And what's important to appreciate, for instance, with the World Bank money, is we borrowed money where it was a 10-year moratorium. So it means we didn't have to pay any principal back for 10 years. And we had a 40-year loan. So it means we had 30 years to pay back, and the interest rate was only 0.5%. Now, that's huge. Now, sadly, it counts towards your debt to GDP, but in terms of your capacity to be able to pay, that's not what's in jeopardy. And so, again, the work that we did in February of 2020 in anticipating where things were going to go, starting the conversations with the indigenous banks, and also starting the conversations with the IFIs. By the time we got to the budget, we had already identified and had approval in principle for the CDB money, the World Bank money, which is the Rapid Response Facility, the IMF money, and also we'd had conversations with the Taiwanese where we had $20 million US going into feeder roads, and we were able to maneuver that. So it meant that going into the year, we knew where the shortcoming income would come from. Now here it is, and this is what we keep on saying, is that while you get these approvals in principle, actually making that happen takes longer. So the World Bank loan only just got approved at the end of the fiscal year. So the good news is that we have done a little bit better than we expected, and therefore we're going to use that loan towards next year's budget. We're also going to use the Taiwanese funds, which now have finally also been approved, into next year's budget as well. But this was the cash gap, and I think that many persons get very confused by the numbers that we use and the jargons that we use. So your budget assumes you're getting all the money and you're paying out all your expenses. But during the year, these are just estimates. It's not until you actually get the cash in your hand or that you actually have the expenses that you actually start paying them. And so this is why when we were negotiating with the civil servants initially, we knew that we would not get that cash. And so what we were trying to do was not to cut their salary, but to say, okay, the country's going to be shut down. You're not going to have the need for a lot of this money. The banks also agreed to give you a moratorium. Can you just take a minimum part of your salary for the first 3 months and allow us to use that cash to be able to pay the other expenses that the state was going to have? Sadly, we were not able to come to any kind of conclusion on that. And as a result of it, government's payables, which normally are around $30 million a year, went to as high as $100 million. And it's very sad because there are persons who would have provided services to the state and who themselves would have expected to have been paid right away. And we just weren't in a position to do that because we just didn't have the cash. So this is where when people say, oh, well, how is it that the government survived? The government survived because our payables went up to that extent, and we've now been slowly working on it. So, you know, the month of February that we just passed is a great example as to how quickly things could change. We were coming out of December, the UK market was back, the hotels were full, people were out shopping, there was a tremendous amount of economic activity, and the month of January was heading to about $90 million in revenue, which is almost getting back to where we originally were pre the crisis. And by the middle part of January, we had to start shutting down again. And the revenue tapered off to $70 million. The month of February, we only saw $40-something million in revenue, which was the lowest month that we'd had. So that just tells you how quickly government revenues are impacted by any type of slowdown in the economy.
And we want to go to an insert, Prime Minister, where we look at the economic recovery and resilience plan that was implemented in being able to help St. Lucians get back on their feet. So let's take a look at that and maybe speak about it in detail.
Phase 3, the Recovery and Resilience Plan, is designed to resuscitate the local economy with the support of public, private, and civil society. This phase focuses on 6 response strategies geared towards stimulating the economy and protecting the incomes and livelihoods of all St. Lucians, as well as to support and protect the business sector from the threat of insolvency. The Recovery and Resilience Plan aims to generate employment and provide income to affected households through an ambitious portfolio of shovel-ready capital investment projects. The plans will focus on expanding the number of households who are currently on St. Lucia's public assistance programs, who were previously unemployed, as well as providing support to other vulnerable sectors of the society. It will also help improve the public and private sector digitization. Health sector reform will focus on providing support to the public health system to enable them to better respond to future outbreaks through improved primary health care facilities, establishing protocols for telemedicine and promoting mental health campaigns to support persons who might have undergone emotional trauma due to COVID-19. There will also be an acute focus on climate change and disaster resilience through various public works programs.
So, Prime Minister, looking back there, making that decision, something that was perhaps it had taken a bit long, but as you explained earlier, when we hear that the IMF had brought in funds, but had approved funds for St. Lucia, the thinking was that the government already had the monies and that the monies perhaps was simply sitting there. But having heard you now, it was a lengthy process. Monies from any of those international financial agencies do not happen on the snap of the finger. But we also have the shovel-ready projects that form part of this economic recovery and resilience plan. And I know that you have painstakingly explained why we are continuing to have those projects. Let's go through it again, shall we? Having a number of these projects taking place across the island, what is the impact that you have seen having to continue these projects? Are you satisfied that what you want to achieve by keeping them going is actually happening?
So I think you have to look at it first holistically. COVID required a multifaceted approach. Because you had the persons who were already vulnerable, who became now even more vulnerable. You now had persons who had jobs before, and all of a sudden their income was gone. And you had a government which now all of a sudden the demand financially was going to be huge, because many of those persons would be looking to the government to get support, as well as the increased cost. I mean, I think that's an aspect that everybody is forgetting here. So there was 2 critical costs that the government was confronted with. One, because of COVID itself, preparing ourselves. So we now know that when we shut down in April, we knew that we were not ready. And so the goal was to adopt and implement policies that protected people and did not allow us to get any kind of a situation where persons were getting affected and we could not cope. We did that, but that came at an expense. So we had to shut down the economy, restrict movement of persons, so that tempered the economic activity quite significantly. And meanwhile, we were spending money to get VH, to buy the PPEs, to try to get the ventilators here, bringing in the Cuban doctors and nurses from early. So I mean, they were staying in hotels, we were feeding them, we were providing transportation for them, going back and forth, as well as getting our persons trained. And we had to expedite and advance the decision to move into OKEU. So things like the air conditioning system that were not working, the backup generators that were not working, the drainage problems, the ventilator problems, the ventilation problems that we were having in the hospital that we thought that we were going to have some time to get fixed. We all of a sudden had to get that done now and you had to do it in a COVID period where we had to get permissions for technical people to travel into St. Lucia. At some times there was no flights, so we'd have to charter flights to be able to bring them in to get this work done. The invisible cost that many St. Lucians still, I can see when I speak to them, don't understand was the issue of your bonds. So every year we have a certain number of bonds that are going to turn over. Means that they become due. And traditionally, almost all of those bonds turn over, meaning that people decide, I had it in for 1 year, I'm going to put it back in for another year. This year, we knew, because of the crisis, that persons may need their own money. And so we anticipated 25% of the persons would want their money back. So that's cash. So $900 million worth of bonds were due. 25%, if I'm not mistaken, is around $175 million of cash that the state had to find. And that is on top of continuing to pay your salaries, continuing to pay your debt obligations, and continuing to provide revenues for the basic operations of government. So there was no savings to be had in any one of those things, and we understood the importance of paying salaries and keeping activities, because if all the other sectors were being affected, you at least wanted government to be able to brace it up so there would be some money in circulation. So the issue of the projects was to say, okay, in the absence of tourism being open and not knowing exactly when tourism was going to reopen, we have these projects. You have these road projects, you have the airport project, you have the water projects, you have healthcare centers, you have drainage projects, all being funded through the World Bank, through CDB, and also through direct finance awards. Those direct finance awards came on the basis of the gas tax we put in. So the gas tax that we put in of $1.50 generates around $30 million a year. So the question is, do you cut off the projects, take that 30 million, or not even all of the 30 million, $20 million of it, and use it for income support? Or do you use that $30 million to borrow $300 million? And that $300 million now is being spent in the economy, and meanwhile, truck drivers are being hired, quarries are staying open, block makers are still in business, and now you're employing people. So in essence, it became a massive economic stimulus program where you are now keeping people employed throughout the island. The other component of it, which escapes me in persons wanting to comprehend and understand what we're attempting to do here, these projects are people-centric projects. These are drains in people's communities to help them with the flooding problems and to deal with building resilience for hurricanes. This is about building roads that have been ignored for multitudes of years and strengthening the communities. So whether you go to Cassimbar, whether you go to Cardinal, whether you go to Bellefonds, whether you come to my constituency in Duga and Lacouville, Blasha, these are roads that have been ignored for many, 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 many years, and are depriving people of a quality of life and depriving people of economic opportunity. So let's take the Saltibus Road. How many farmers do they have living on the Saltibus Road? But also, how many new persons who are getting into the Airbnb business? Now all of a sudden, you go online and promote your home or your room on Airbnb, and you have this fantastic road to help. And I go to Cassimbar, I go around the island and see that, Dennery South, and this expansion that's taking place. So what we said was, these monies that we're getting access to had already been negotiated. In many cases, you could not use it for anything else. It's not like to say I could borrow $300 million and use that now for something else, because the money was being borrowed on the basis of the gas tax. And that what they wanted to see is the investment would increase the capacity of the country. So I think in hindsight, it was the right thing to do. I would do it again. I think that there are many countries in the region that were envious of the position we were in because we were able to execute that part of the program so quickly. And there are countries who are only now trying to implement the same thing. America, Canada, Britain, Barbados, Antigua, Dominica, okay, St. Kitts, everybody now is realizing that in the absence of tourism, that we need to create economic activity somewhere else. And that it would be much easier to borrow monies to get those projects off the ground, and they make a double impact. The impact that they create is, one, immediate jobs and economic activity in your economy, as well as now strengthening your economy so that when you come out of COVID, that you're actually a much stronger country. So, and a remarkable statistic that was shared with me recently is that between July of 21 and December of 21, we're actually going to have more airlift than we had between July 2019 and December of 2019. Right? Now, that came out of confidence. They saw the hotels remained open. They saw that we didn't overreact. They saw that the bubble that we have has worked, and they've continued to market St. Lucia, and the demand for St. Lucia is high. So as they're now starting to see the recovery, a lot of airlift needs somewhere to go to. So they're going to start with where they've had that relationship. The cruise industry, who had never thought of having a summer program in the Eastern Caribbean. We're all old enough now to know that the cruise industry is only for the winter. We now have new ships coming to home port in Barbados and looking to start as early as June and July this year. And what they're saying is that, okay, they would have never thought of doing this, but because of the success within the Eastern Caribbean, and particularly the potential inoculation or vaccination of the populations, and we're so much ahead of everywhere else in the world, that this now offers a great opportunity. And if it is successful, which we think it will be, that's something that will continue. So here is now, coming out of COVID catastrophe, we deal with it, we confront it, because we've learned down here that when we have hurricanes, you can't sit here and cry about it. You need to confront it, deal with it, and move on. Coexisting with COVID, meaning don't allow the catastrophe to completely destroy your economy. Try to preserve as much as possible, work through this thing and get past it, and then good things start happening to you. So the work that we were doing in fixing up roads, fixing up drains, community centers, healthcare centers, all people-centric and community-centric programs. So I would like to think that the population of St. Lucia would have an appreciation that this wasn't about building hotels or about building big administrative buildings, which is difficult to really appreciate how that benefits me. But certainly having a healthcare center fixed up in your community, or one being built for the first time, having your community centers fixed up, having your roads fixed up, having playing fields fixed up, having drainage programs, having water being expanded because a lot of the pipes of rotten or didn't exist in the first place. These are all about strengthening your community. So I think it really has been a significant win-win-win situation for the public of St. Lucia at large, for the economic activity, the community, the persons living in the communities, and then thirdly for the country, because now it's certainly making the country that much more, that much stronger. So you take the Rodney Bay Road as an example. This has been a vexing problem for the longest time. Anybody can see that the entrance into Rodney Bay is a bottleneck.
A bit of a problem.
Right? And the fact is, putting a roundabout in that location would have required us to acquire the 3 homes on the other side of the road. And so the idea was, okay, let's do 2 roundabouts, one by where the 2 pillars are and the other one by Key Largo Latreille Road, which has just recently been done. So when I come out of Rodney Bay, I have 2 choices. I can go to where the pillars are if I want to go to Castries, or I can come out at the front and make my left and go to Groselet. But similarly, if I want to, I can come out by the left, go to Latreille roundabout, go around the roundabout to go back down south again. But this is going to, in our opinion, really help the congestion in the area. It's an area that needed to be done. And what better time to do it than right now when you don't have the level of traffic. So even the Millennium Highway, I have to tell you, we met with CDB and we pushed hard to say, come on, let's expedite this project. One, because it's going to create economic impact, but two, with the current
limited movement.
The limited movement on a critical road, go get this thing done now. So I'm very grateful that the road project is about to begin, the bridge in cul-de-sac. And again, these are all grant monies. There are some contributions that we have to make as a state, but they pale in comparison to the total amount of money. So getting these activities going was really essential in terms of helping to stave off. So you look at the jobs that were created there, the ICT centers, GROW, KM Squared, ITEL BPO, Ojo Labs, just to name a few, all have increased their numbers, because when Jamaica had a problem in their call centers with COVID, all of a sudden those companies said we need to diversify.
And St. Lucia became a beneficiary for that.
Correct.
But Prime Minister, we want to be able to say good day to the Minister for Education, Innovation, Gender Relations and Sustainable Development, Honorable Dr. Gail Rigobert is with us. She's on Zoom with us. And good day to you, Dr. Rigobert. And we'll have a discussion with the schools.
Lisa,
and the
how
department.
are you?
Doing wonderfully. Thank you so much for joining us on this Saturday as we look back at what COVID-19 has done to our beautiful St. Lucia, restricting our movement and our schools having to close, having to institute learning, virtual learning, and certainly it has been a challenge, but we seem to be able to rise to that challenge at every given time. Dr. Rigobert, for you looking back at what the impact has been for education, can you speak to us about how you feel about some of the decisions that have been taken over the last year?
Thank you, Lisa. Hi to you and to Jesse. Good morning, Prime Minister. I am very happy to be able to join you this morning. I'm sure it is now well established that nobody had the blueprint for dealing with COVID, and we were all dealing with it as we went along. And that is also true for the Ministry of Education. I must say that I saw a display of resilience, commitment, and agility. Agility is very important because you will recall that things seem to change so quickly. The situation was so fluid that we had to be in responsive mode, in proactive mode, to be able to preempt some of the issues, but more importantly, to stand prepared to ensure that we minimize disruption to instruction. And I wish to say that again, Lisa, because given all that COVID connotes, our concern was what can be done to, one, minimize disruption to instruction, ensure the health and safety of our students, our staff, our educators, and to ensure that we can, with the technologies available to us, leverage these technologies to satisfy the delivery of the curriculum. You will recall the many adjustments that we had to make, including, of course, having to close school. Thank goodness, Lisa, many people were not aware of that, but thank goodness we had employed significant resources, energy, time, and effort in training many teachers and outfitting schools with the requisite technologies. What COVID did was to present us with an opportunity to accelerate plans that were already in the making with respect to the integration of technologies into the curriculum. And I must say, and I'm sure you saw it yourself on social media, that the level of subscription, the uptake by so many teachers who were eager to enhance their own skill sets to ensure that they were better equipped to deliver to our students via the online modality. I wish to thank Prime Minister, who is in studio with you, because although education has always been a priority, in a situation such as what we are going through now, the COVID-19 pandemic, resources become even more scarce. And there's even more pressure on a Minister of Finance to determine what is priority. I want to thank Prime Minister and my cabinet colleagues for ensuring that indeed we matched our resources with our rhetoric in saying that education is a priority to this government. Therefore, Lisa, notwithstanding the challenges, and there are challenges, and we're not running away from these at all, because we appreciate very clearly that if it is we are to improve upon what it is we are currently doing, we must be true to the challenges to the extent that we are cognizant of them and are working towards resolving them. In that regard, therefore, we were able to move from a pilot program with our ebooks, our learn books, and by learn books we mean tablets that come preloaded with the CXC curriculum. So whereas initially we had started with a pilot program in Form 3, given COVID-19, we were able to accelerate the full implementation of our ebook program to include the lower forms, Forms 2, 1, and of course the upper forms from Forms 3 and 4, understanding fully that Form 5 students in the main already had devices, but where there were students who were still without or that their devices had gone bad, the ministry sought to address that as well. Very importantly, Lisa, with respect to connectivity, because we cannot speak of distributed learning, which includes online learning, and not pay due attention to connectivity in homes. You know that whereas we have a very high cell phone penetration on island, when it comes to connectivity, Wi-Fi connection, for example, it does not match the level of penetration of persons with cell phones. And so we were able, with the kind assistance of district education officers, principals, and our corporate units at the ministry, to identify families, households that were in need of connectivity. And although we had already made some progress with the GINet, for example, and CARSIP in schools and in communities, we recognized that there were still households that were without internet connectivity. Thanks to the NTLC and the partnership with the Minister of Economic Talent, Minister Guy Joseph, and his colleagues, we were able to source at least 5,000 MiFi devices that will be distributed to households. We have started that distribution. I can tell you it has brought significant relief to households because there's not so much pressure on families to try to congregate near an ICT center or GINet point, because we are trying to maintain social distancing. So therefore, by having the MiFi devices in households, we can ensure not only do students have the connectivity that they need to follow their classes, but also that you reduce the temptation to congregate around a hotspot, so to speak. I must say, for those of you who are yet to receive those devices, that the program is unfolding and we will be coming to you. You can well imagine the logistical challenge of ensuring that we distribute all these devices in quick time, but we are ensuring that devices really get into the hands of families who really need the connectivity. I must say, Lisa, what COVID-19 presented as well was an extraordinary demonstration of interagency, interministerial collaboration. We could not do what we did in education without the kind assistance and partnership with the Ministry of Health, other stakeholders such as the National Youth Council, the National Student Council, the trade union, and other sectors and subsectors. And that kind of partnership, that kind of engagement, consultation, dialogue that helped us to fine-tune what we were doing as we went along. Is it yet perfect? No, because there are children who are not yet maximizing on the full opportunities presented, and that is what we continue to work towards. I'll stop here for now, Lisa. I'm going to entertain another question should you have one. Thank you.
Absolutely. We're following up with you, Dr. But Jessie?
Definitely. We'll come back to you, Dr. Rigobert, in just a moment. But a quick question for the Prime Minister. Speak to us about ICT education overall. We've come leaps and bounds, of course, expedited by the pandemic, but definitely the government of St. Lucia has achieved its mandate in many respects in terms of getting these devices to the students and teachers. So the idea of technology in education is not something that just came out of thin air. If you go back and look at the vision of the United Workers' Party, we talk about a globally competitive education system.
So we think that the education system here has to be broadened to allow solutions to compete with foreigners coming to live here, as well as solutions who are traveling abroad, that they have to be able to compete. And we always understood that the ICT sector and technology and understanding the digital economy was critical. So the devices that the minister is talking about, we had been in search of. And so we were so grateful when we were able to find a device that actually did what we had imagined in our minds. The idea of having an iPad that now has all of your school books on it. So this idea of young ladies carrying these heavy books to school, I know talking to the young girls in my constituency, they complain about it all the time. Parents who are having to find $800 to $1,200 year after year to buy new books and being frustrated of having a new edition. And because it seemed like a minor adjustment to have to go now and buy new books. When you then now take me as a student, not the best concentration skills when I was young, you can go and film the best teachers. Why shouldn't we all have the access to the best? So how do we grade our teachers at each of the different levels and each of the different subjects and film them? Now that's a permanent record. And I can go back and play a class tutorial over and over again and until I understand it. And then there are links now in that device in each of the chapters. So if you want to do research, you just press the link. If you're doing a science lab, it actually physically shows you the chemicals being integrated. And guess what? The device that you're using and what you're learning on, when you go into your workplace, same thing. So for me, early on, as an example, when Ojo Labs came here and was using artificial intelligence to sell real estate, not to bend people's minds. That artificial intelligence company came here, and a young guy identified a program problem, didn't say anything, went home and spent 6 weeks rewriting the program and presented it as a completed project to the guys at Ojo. And David Rubin, who was the owner, said to me, okay, we've got, PhD engineers who put this program together, and at some point would have probably picked up on the same thing. But the fact that he took that initiative and had the capability of doing what he did was extremely promising. And he was identified in the first round of hiring. So they're saying that there are gems like this all over St. Lucia. And what is the cause of that? One is obviously that kid's desire to be in that sector. Two, we have to thank Digicel, I have to be honest with you, in smartphones. So the penetration of smartphones in this country are great. The same guys at Ojo had actually been here before with a company called Yodel. And they were blown away by St. Lucian's ability to multitask. Be on the phone, typing, and analyzing all at the same time. And they said that this was really a unique skill set in which we excel at. So these are skills that are international skills. What has COVID now said to us? When I heard that Google say that the persons who are working from home are going to continue to work from home, I got excited. Because it means now the dream or the aspiration or the belief that we were going to have now a borderless companies is now becoming reality. What do I mean by borderless companies? So if in fact you can work from home, why can't a solution be working from Google from here? They don't have to get a visa. Okay, they get to stay at home. And so therefore some of the things that would have been problematic for them previously, now those borders are gone, those barriers are gone. And it's for us to really excel. So the quicker we can get our education system digital, it helps in terms of where we're going from a country. So we have 72 services that the government is going to be offering as digital. You're now already getting your driver's license. You can make payments. The goal is that you can register your home. You can sell your home. You can get your birth certificate. You can apply for your passports. No longer are you going to have to go and take lines. Now, it doesn't mean that you can't go to an office if you want to, because there's some people who sadly are not going to get into the digital age. But for the most part, people are embracing these ideas. And what are we seeing? The resilience that we would need to fight off a viral pandemic in the future. Digital helps, because it minimizes unnecessary person-to-person contact. So the education system today now is being changed to incorporate all of these new learning skills. I can go online, I can get classes at MIT. I can get classes at Harvard. So even this idea that how many kids here, we know that 2/3 of our young people don't get access to tertiary level education. That may become a thing of the past very soon. And what's great is to see the appetite of our young persons in that regard. The Prime Minister's playlist, 42, was really a huge opportunity for young persons to say, we may be down, but we're not out. And that we've used our time to come up with new songs, with new creative ideas, and for us to see as St. Lucians, to have confidence that we are world class. We can compete against the best in the world. We have an amazing product. And it's to encourage more young persons to understand that there is a global market now. Don't think of it just as St. Lucia. So I say to my good friends in Kaiso, I mean, I love the pecan of the songs about politicians, but it's a limited market. Whereas there are songs in groovy soca and power soca that can become now international songs, and your market becomes much bigger. So think of themes that are much more global, universal than just colloquial in the sense of just being in St. Lucia.
Let's just bring back Dr. Rigobert. Dr. Rigobert, we are seeing the transformation of classrooms, and that is happening under the ICT in Education program, which is being supported by the government of Taiwan. So with the smart classrooms, can you explain to us what that really means?
Thank you, Lisa. Many people perhaps did not realize that we had started that process well before COVID, to the extent that, for example, we converted existing technical drawing classrooms into technical drawing labs, integrating a state-of-the-art technology. For example, AutoCAD, as we know it, has evolved, and no longer do the old modalities for teaching technical drawing hold. And we need to ensure that when our students graduate, that they are market ready, that an employer can readily embrace them into his or her workforce, and so that they are au courant with the technology of the day. So we had already started that process with our technical drawing labs. Also, with respect to the GINet and CASIT, we had gone to great lengths to ensure that there was great connectivity at many of our schools, and where there are lingering problems, we continue to address those. What it means to have a smart classroom is that you have an interactive whiteboard, you can project your lecture notes, you can leverage various teaching programs, Google Classrooms, various social media platforms that allow for interaction between teachers and students. It means that students who have the technology available to them can interact with whiteboards, with teachers, with maybe they can connect to other spaces as well. I don't know whether you recall, thanks to the Global Partnership in Education, the GPE, we were able to secure recording equipment, some of which would have been placed at the various district education offices around the island, and to facilitate exactly what Prime Minister has described, and that is to attract, to encourage, to cajole, to ask teachers who are very good at what they do, please, can you record those classes so that students can access on their time, because we learn in different ways and at a different pace as well. And so we are continuing to work on this, but it means, in short, that it is a classroom outfitted with the requisite learning technologies and to allow for those to be integrated in the experience of teaching and learning.
I think it's important with what Gail said, that with this idea of filming teachers, it's not about replacing the existing teachers, but to complement them. And certainly this idea that you have to go to a particular school to have access to the best. So everybody lines up to go to St. Joseph's Convent or to St. Mary's College or to the Hess School, etc. But we are not going to become really to our fullest capacity until everybody feels that they're having equal access to the best. And so by filming those teachers, you create that level of balance. And I want to say that certainly I know in my own constituency and meeting with some of the parents, a lot of these jargons, they don't understand. What they do understand is that the education system is being adapted to make sure that their child is going to be given a very fair opportunity to compete globally. So in the early days, the professions that parents would try to send their kids into is become a doctor, to become a lawyer, right? Or an engineer.
That was, I mean, the professions where the supposed prestige and more money is at, yes.
Correct.
Yes, yes.
And you know, and if you told your parent that you were going to go into the arts and become an actor or singer, right, you were ridiculed. So the goal here really is to give our young people the skill sets that they can compete on a global basis. And it really is to convey that message to the parents, because, you know, white boards and this and that. And even with the EPAD, now the conversations that are taking place between the teacher and the student now are fully recorded. So if I go in as a parent and I say to the teacher, what's going on with my child, the teacher is actually able to show you a record of I've been giving them help, because when they're at home, the student can actually contact the teacher at their home. And that whiteboard technology can also be applied to the ebook. These are technologies that when they get into the workforce, they're going to be using. So they would have already had the advantage of using that, which now improves their level of productivity. And certainly in using the technology to expand on their own creativity. So you're giving them the skill set. So I always use the example of an iPhone. You could make a movie with an iPhone. Couldn't do that before. To make a movie, it was almost, we were alienated or prohibited because the cost of a camera and to get all, you'd have to go off to university. I can go online. So, you know, my very good friend Jalam, Udovic,
yes,
when he made the transition from woodwork to bronze, he studied. When he was given the opportunity, he didn't turn it down. He went and got a books and he went online, and as he was going to China, he was teaching himself. But the basic form, so it's amazing to watch him work. All of his bronze sculptures start as a wooden sculpture. So he does it in wood first, which is what he's very comfortable with, and then works with the experts to transfer that into now a bronze product. And I'm just saying that that's the way the world has become. We don't have the excuses that we had before, and for us in the education system, what Gail was talking about, how do we help kids see the opportunity rather than to make excuses? And that's really where the success is going to be. Derek Walcott and Sir Arthur, Julian Alfred, Darren Sammy, the list goes on, Laverne Spencer, never focused on why I can't do it. They focused on how I was going to do it. I guarantee you that that's what they stayed on a positive thing. And we want to make sure our young persons do not ever feel limited by the fact that they come from a small island, and that we want to use that smallness to our advantage to become, and I like the word that Gail used, the flexibility. That was really critical in learning how to deal with COVID. Make the best decision you can. If in fact some of the things are not working out, change them. Don't be so scared of making a change, but always keep your eye on what's successful.
Honorable Dr. Rigobert, I want to go to you. Switching portfolios to gender relations, we know that one of the pillars of the economic recovery and resilience plan is strengthening social protection systems here on island, but Talk to us about what has happened in the last year in terms of gender relations, the work that is ongoing to assist persons. We heard from the Royal St. Lucia Police Force that there were instances, a spike, I should say, in domestic violence and contentions within the home, you know, an implosion sort of based on persons being relegated to just the household. Speak to the work that is going on within your ministry, your department, even collaborating with other agencies to assist these affected persons.
Thank you, Jesse, for that question. Jesse, all over the world, women accounted for the highest number of workers directly involved in managing the health crisis. Women accounted for the highest number of employees who lost their jobs. And women accounted for the highest number of people who experienced abuse as a result of necessary measures such as partial and complete lockdowns, as you just referenced. And in fact, domestic violence was declared the shadow pandemic by United Nations Women Organization because of the increase in domestic violence recorded around the world. And Jesse, that reality is also true for St. Lucia. So we did see an increase in the number of cases of abuse to the extent that we had to repurpose some of the resources that we had earmarked for other programs prior to COVID to ensure that we invest in more programs that serve to cushion the blow, both literally and figuratively, for those women who were affected by domestic abuse and all those women who lost their jobs. In that regard, therefore, I'm compelled to thank the government and people of Canada for working very closely with us to ensure that we have the requisite resources, not only to offer short-term cash interventions, but also, as we are now doing, to expand the Safe House, to expand our psychosocial support program, to work more closely with the Royal St. Lucia Police Force and the Ministry of Equity, Human Services. And very importantly, an initiative that really warmed my heart, because I don't know the extent to which we realize how many women are small entrepreneurs, how many rural women, for example, are involved in farming and agro-processing. And so we've been able to partner with the FAO to secure resources and technical assistance to improve on the skills of these women that will feed into them enhancing their service offering, enhancing their products, doing things better, smarter, more efficiently. And therefore, what you saw was an intervention to cushion the immediate economic impact of COVID, but also to better prepare our female entrepreneurs, not only for the opportunities that exist because of COVID, because there are some opportunities that have arisen because of COVID. You will see the number of women engaged in making masks, for example. Many of them have been able to benefit in that regard for those who had that kind of transferable skill. We were also able to encourage many of them to take up the free courses that were offered by Coursera. And many young ladies in the hospitality sector in particular were able, in a sense, to consider a career change or shift in the interim and to do some multimedia digital courses, whether it be in graphics and web design, etc. So at least that they could, do something in the meantime. We also offer support on small business administration, the financial and accounting aspect, again, all of which was packaged in such a way that would present a sensitive, pragmatic, useful response to our women because of COVID-19. And in some instances, these programs were already in train, but they were modified and or accelerated to accommodate or to respond to the challenges of COVID-19. So let me say that we have an expanded facility, an expanded safe house. In terms of the psychosocial support, we've been able to benefit not only from what we offer in-house, but thanks to the collaboration with other agencies, such as health and human services, we've been able to expand that offering. And while I'm saying that, that is also a service that we offer not only to students and teachers within the COVID-19 context, because you can well imagine the level of anxiety that exists among our children and, of course, teachers, and that may very well be true for other professions as well. But with respect to what exists within my purview, I can say that the school counselors have done a tremendous job of responding to the social, behavioral, psychological, emotional challenges that came with COVID. And with respect to gender in particular, our women who were abused or found themselves in some kind of difficulty, they continue to access our services as well. Let me also say that we pay particular attention to those women who have been through abuse repeatedly, and that intervention is not just a quick short-term intervention, but working along with them, whether it be in terms of counseling and or finding them suitable employment so as to enhance their economic position, so as to reduce their vulnerability, so to speak. So the intervention is multi-pronged, as you can tell, and it's disheartening that we had to respond to so many cases. We had to amplify our effort, but I'm grateful to the Canadians, to UN Women, UNFPA, FAO, all of these organizations. Thanks to their technical and financial input, we've been able to respond.
Thank you, Dr. Rutherford. We definitely want to boomerang with you on the education sector in just a moment. But Prime Minister, back to you in terms of strengthening the social protection system, something that was very critical on the part of the government of St. Lucia. The airwaves seem to have dominated with the construction sector and fast-tracking shovel-ready projects, but that was another critical, strengthening social protection systems was another critical element on the part of your government in terms of stimulating the economy, having the dual effect of stimulating the economy as well as addressing that social, predicament. Speak to that development.
So again, from a digital economy perspective, what we had been working on is creating a singular ID. We have NIC, but it's not universal, meaning not everybody has an NIC number. You have your passport number, you have your identification number, and so it's to really use that ID number to broaden. So from the time you're born, you have an ID number, and it'll be automatically linked to all of your other identifications. Why is this important? When we went to Estonia, we saw that they became paperless, and it meant that persons who were in need of social support didn't apply. So once you were a single mother, as an example, and you lost your job or don't have a job, the system identified you, and automatically you would get benefits. Our benefits were limited to 2,200 people. That's what we identified as our vulnerable list in St. Lucia. And as I said, and I get very upset when we go home thinking that by subsidizing rice, flour, and sugar, that by having a zero VAT rate on food items, that somehow we're helping people.
We've done the Lord's work.
Come on. And there are many more people that are in need of support in this country. And so how do you do it on an equitable basis and that there is a follow-up? So the reason why we put local government in with community development or equity was for that reason. We think that policy should be on a national basis, but execution needs to be on a constituency basis. So just imagine, if you would, a town council, right, that has the ability of going on a regular basis to the households of persons who are getting support, to confirm they need the support. Are they getting enough support, or should they not be? Are they abusing the system, right? So a single mother, and I'm sorry for using a single parent, let me put it that way, because that's, I think, is more relevant, who doesn't have a job but has young kids, that child should automatically get their school books, automatically get uniforms, automatically get part of the school feeding program, automatically be part of the transportation program, and that as resources become available, the support that we can provide in our social programs becomes even more critical. That is what we were working on. So when COVID came, and now the number of persons and the need grew immensely, the question became, how do we do that? And this is why you had the NEMO list, right? You had the Ministry of Education's list, you had Equities list, you had Parliamentarians list, all right? You had Red Cross list, and they were never cross-checked. And we always only point to the bad. The bad was that there were some people who were on 5 list.
Duplication.
Okay?
And people who needed
and then you had people who are not any on the list. Okay? And so this is why we immediately were trying to chew gum and walk at the same time, in terms of getting the councils involved, getting the politicians involved, getting Red Cross involved to try to now resolve it. We were able to add an additional, I think it's 1,200 people to the list. But in addition to that, we had a feeding program. So we were providing food. We tried to do hot meals. That worked to some extent, but it wasn't as effective. So we now said, okay, let's link it back to our farmers. The farmers have lost the market to the hotel sector. Can we buy product from them, package it, and get it out to the people that need? And that worked much better. And then add protein. So the 2 sources of protein that we produce in St. Lucia, in a meat form, because there are other forms of protein, is fish and chicken. And so again, we were working with those, the Ministry of Agriculture, to identify those sources to include that in that distribution. We then helped from a health perspective. So there was a gentleman that was on TV recently talking about his experience at Victoria. And I think the thing that, even for me as Prime Minister, that really hit me, certainly his appreciation for what the staff were doing, and how sometimes we are very cold in belittling people, right? Even our own, to somehow suggest that the people at Victoria Hospital cared less. And we're not as good. So when you hear those stories, and there are many more good stories like that, of persons who went there petrified, thinking that they were going to die, and being so surprised within 48 hours as to the level of care, the quality of the facilities, the access to medicine that was taking place, and that they start coming. Because even some persons who I know call me up, within the first one, please get me out of here, right? And then all of a sudden call me and said, no, everything is good, and I'm really happy that I'm here. I'm saying that in the healthcare aspect of it, we provided it for free. That was the message that really resonated with me in terms of what he was saying. For free. So in having to deal with a health crisis, and then now adding on top of that a financial crisis, was a huge relief for a lot of people, that you knew that just stay out of the way of COVID, but if you do get affected, that you're going to be taken care of. So there was food, there was health care, there was what Dr. Rigobert was talking about from an education perspective, expediting things that we were already going to do with limited resources. And that's what I'm very proud about this government and what we've been able to achieve. We never made excuses. We saw the need and made it happen. And I think that the relationship that government, not politicians, government has with the private sector and civil society really improved significantly. And we've seen how much more that we can achieve collectively together than trying to constantly fight each other. So probably a very visible one would have been the Medical and Dental Association. Relationship really didn't start off that great, but we kept on working at it, trying to take into consideration everything that they were saying. But at the same time, we in many cases had access to more information, but more importantly, we were making a bigger decision. So sometimes civil society groups focus on their own little area, That's not to take away anything, because that's what their job is to do. But government sometimes has to have a much broader picture and balance out all those different things. And I think that we learned a lot in communicating with each other and respecting each other's decisions. The Tourism Association, there are decisions they're not happy with. But the reality is that when we have to balance curfews and everything else that's taking place, there are going to be sectors that are going to be impacted. The rent-a-car have not been able to get going. The restaurants have on and off and on again, and this is money that they cannot recover. So your expenses are there, but there's no revenue coming in. We all know what that is, and it's no different for the government who's had to act in that regard. So the social aspect in terms of income support, in terms of food subsidies, and in terms of employment generation has been a three-pronged approach, and the fundamental of all of that has been health. So making sure that persons would always have access to, whether it's a vaccine, whether it's to going to the hospital, whether it's in quarantine services. I mean, again, we're reflecting. Every single solution that came back home was put up for free. In a quarantine area, and those persons who may want to question whether that was good or not, that was a fundamental part of the success of keeping COVID contained. Sadly, not only in St. Lucia, around the world, when persons home quarantine, they're just not as committed to it as when they're under administrative quarantine. But that administrative quarantine came, I heard the Commissioner of Police officers, nurses, doctors, the gentlemen who are carrying the ambulances back and forth. Medics. There's a lot of people, and then all the medicine, and then the food that was going in there as well, the staff to be able to do the laundry because the sheets have to be cleaned on a regular basis, person's clothing has to be done. All of this was being done.
Utility.
Right? Well, the utility companies, thankfully, on those centers waived the cost to us. But somebody paid it because that was less revenue going into the utility companies. But it's not to underestimate how much money was going in and manpower. Because money is one thing, but equally restricted or having access to is manpower. So when we started to have an outbreak in January, and you're talking about police stations, healthcare centers, businesses, ministries, I mean, the delay in the budget. The budget department had people affected. The ministry, the financial center building had to be closed for a period of time. The number of people that we have that are running all of these things in St. Lucia, a limited number of people. You cannot replace a nurse. We're trying to find more nurses. We can't replace doctors. We can't retrain policemen. The wardens have done an amazing job, but a warden is not a replacement to a police officer. So I'm just saying that there was a lot to navigate. There was a tremendous amount of uncertainty every single day. So even going into this budget process, we can only guess what the revenue number is going to be. I have no idea what's going to happen. I mean, are we going to continue to get vaccines and that we're going to see an abatement? Or are there going to be a stretch period of getting the vaccines? We still don't know whether when you get vaccinated, whether you can get sick or not, and whether in fact what you're doing can be transmitted. If you have symptoms, whether it's transmittable. We don't know. Right? We're going into this thing with still a lot of uncertainty.
Much like how we began when COVID.
Correct. And the key here is not to allow that uncertainty to paralyze you. Make the best decision that you can. Be committed to what you're doing to implement. And Gail said it 100% right. Be adaptable. Be flexible. Okay? And give everybody the benefit of the doubt. Everybody wants the best interest of everyone. But the idea of completely shutting down an economy is not in the best interest of a lot of people.
It's not in the interest of anyone.
Okay? It's just You talked about the mental wellness of persons. You talked about the social domestic issues. Kids not being able to go and play and socialize, right? They're the ones who've paid a huge price. So when we sit in cabinet, these are all the things that we have to take into consideration. And while you may have to shut down temporarily, we know that it can only be temporarily. And then how do we get back going? And so I just want to say that COVID should empower all of us, because COVID has shown us once again that solutions are prepared to rise to the challenge. Now that we've risen to that challenge, are we willing to embrace the new opportunities that are going to be put before us? And those new opportunities are going to require us in some ways to change. Right? So 9/11, when we had the crisis of the World Trade Centers, created a change. And airlines had to learn to adapt. People had to learn to adapt. You have to go to the airport now
2 or 3 hours ahead.
2 or 3 hours ahead. But guess what? If we went and we took away those securities today, people would feel naked and vulnerable. COVID is going to change us. I think how we deal with public spaces, how we interact. The flu has gone away. So is this now going to become a permanent fixture? And say, wow, okay. We saw it in Asia after SARS, and let's be fair to ourselves. When we would watch TV shows and you would see Asians walking around with a mask, all of us, me included, would go, what are they doing? Yeah. That was long after SARS. So I would say to you, I think that there's going to be persons in our population that are going to continue to wear a mask, and persons with underlying conditions. And this war of non-communicable diseases needs to be a war. And this is why our government wants to get healthcare insurance in play. With healthcare insurance means that every single solution now can go to a GP. Because now we're going to have, and I want you to see how all this connects, because now you're going to have a singular ID number and a national database of information on people. When you go to the doctor will enter in your health conditions. The computer system will extract it not by name but by gender and age group. So it means now we have a current report on the health of the nation. The Ministry of Health now can design programs to deal with critical issues. So we know if we can lower diabetes and if we can lower high blood pressure, that's a huge reduction in the cost of healthcare. And it means that now those resources that would have been applied to solve that problem now could be applied to persons with cancer or with other ailments, which there isn't as many easily solutions to those problems, right? But you can't do that unless you have accurate information. So the Ministry of Health now will know, are my policies working? Are they not working? We'll know what the cost of healthcare is. So from an insurance perspective, the insurance companies' rates are going to be high initially to solutions because of the prevalence of diabetes as well as high blood pressure. But now as we start showing the policy and all of a sudden the insurance companies now see the prevalence is going down, huge benefit. The COVID has shown us that we're vulnerable. So sadly, the number of persons who have died in recent times has a lot to do with the health of our nation.
And we hope in PM that the vaccines, and there's been a tremendous response by St. Lucians to getting vaccinated. So we're hoping that the vaccines will be able to take us past the trauma of COVID-19. How do you see that fleshing out for us? You mentioned, you just alluded to continuously getting the vaccine. Would the decision be to perhaps get a huge amount in at the same time, or to stagger along the way so that we towards herd immunity? What is the thinking of Cabinet at this point? What is the capability of the public police at this time to be able to get the vaccines in?
So there's two parts to that problem. Cabinet's decision or policy is to get as many people vaccinated that want to get vaccinated as possible. And it hopes that there is at least 70% of the population that wants to get vaccinated to create, and that's just a number. Nobody knows what that number really is, what they call herd immunity. The second part is to get it. You know, I don't want to sit here and tell you that getting the vaccine as simply as going to a grocery store or going online and ordering it. The geopolitics is very much at play. And we saw it when it came to the ventilators, we saw it when it came to PPEs, we saw it when it came to toilet paper. We forget that, you know, in the early days.
There's a shortage of toilet paper.
Right,
Yes,
we saw on
was.
TV that
people were fighting literally over bales of toilet paper. Yes.
I mean, really. So this still very much prevalent. We were very fortunate through the incredible generosity of Prime Minister Modi to have gotten the vaccines we've gotten. They're much bigger countries, probably much more important geopolitical countries, and for him to have seen fit to make that happen was incredible. And I really want to thank also Prime Minister Skerritt because he certainly was the first person to make that entree and to get the vaccines here in time. And I think that you've seen a level of camaraderie. When they received their vaccines, we already knew that we were also going to be receiving our vaccines. They just decided to get a private plane, which eventually we had to do the same thing to be able to get the things. But they shared, and equally, Grenada wasn't on the next round. But we knew that Grenada was going to be getting, and therefore we all shared with Grenada. So the couple of sources that we know are available. So out of India, we've not been able to buy the vaccine, the AstraZeneca, because of licensing issues. They are currently very close to getting their vaccine approved by WHO. So that's another decision. We can't use any vaccine, we've agreed, that has not been WHO approved. So we're hoping that that's going to happen. AstraZeneca was exporting to Australia, and Italy prevented them from sending it to Australia. I'm just saying to you, these are big countries, and everybody is in the same situation, and everybody's trying to take care of their citizens. And so the next round is supposed to be coming from COVAX. We're continuing to work with the Indian government. We're working with the government from UAE who have vaccines, but those vaccines have not been approved by WHO as yet. We have a group working on Johnson & Johnson because obviously that's a significant advantage in terms of having one injection. I don't know where it's going to come from.
Pfizer.
Yeah, I don't know where it's going to come from, Lisa, but I can say to you that we will get.
Are we also working with the African Union, with the African Medical Platform?
Yes. So again, you know, a lot of persons, and I remember being in a meeting recently, and they're saying, would you be willing to do this and do this? And I said, yes, but when I get, everything's in theory, right? But it was the same thing before we got this current crop of vaccines. You just have to keep pushing, and I can just say to the response that we're getting from all the different sources has been very positive. I believe that the COVAX will be here very shortly, and my understanding is that COVAX, because we were with the French ambassador yesterday, the French government are huge contributors to COVAX, and so are the Canadian government. The US government just put $4.4 billion into COVAX, that we're actually going to get more than the 20%. So the goal is to try to have vaccinated everybody by June. The return of tourism is very strong. Every single time that we saw that the borders were reopening, there was a significant uptake in tourism arrivals. We also saw in the US economy that when the job numbers completely collapsed, it only took a matter of 3 months to regain a significant number of those jobs. So that's very encouraging, and the amount of money that countries are pumping into their economies by printing money, not great, but it's going to create a tremendous amount of liquidity. Sadly, we've seen the price of oil going up, and I think that that's obviously in anticipation of a boom, combined with the fact that there has been a curtailment in production. So there's a temporary increase in the price of fuel. I think we're at $65 a barrel, you know, which is not great. But I've also seen that the pound has been rising. They're now out of Brexit. And so there's all these things that we're digesting, all this information, to try to position St. Lucia in the best way possible to get recovery as quickly as possible, and to remedy some of the deficiencies that we have and the vulnerabilities that we have. Healthcare, education, digital economy, infrastructure, all of those things. We're still taking on all of those things, and then now trying to deal with the financial situation of St. Lucia, because the debt to GDP has gone up for two reasons. One, the borrowings that you had based on the shortage of income and the turnover of your bonds, as well as the contraction in your GDP. Those two things have brought your debt to GDP number higher. But if you get a quicker recovery from the GDP, then it will come down. And if in fact we can now resolve some of the monies that we've had to borrow, because we continue to argue at these international forums that you've seen me on, I call it catastrophic debt. So I'm saying for small island developing states, monies that you've had to borrow, whether it's for a hurricane, whether it was for the financial crisis, whether it now is for the pandemic, that how do we classify that debt? Because these are not as a result of bad policy by the state, but are having a significant impact on our ability to finance ourselves. And that's the ongoing conversation that's taking place. And the last one I really want to say is that there are two things that, in my mind, globally, that we have to resolve. One is deeper integration. The only way that we're going to reduce and strengthen the effectiveness of governance in our country is by regional integration. We don't have the size of the population to do these things by ourselves. So whether it's the justice system, the security system, education, healthcare, all of these things can be significantly improved because they don't make us more or less competitive against each other, but by strengthening it, makes us more competitive against other countries of the world. The other one really is our banks. Our banks are very liquid, but our banks seem to be reluctant or hesitant, I shouldn't say reluctant, hesitant on investing in businesses. They're investing in homes, they're investing in cars. And we feel that the time has come urgently to create an equity fund. So what's an equity fund? It's a pool of monies that actually can go in not as a loan into a business, but in the form of preferred shares. So it means that there is not debt that business has to carry, and then it can borrow money. So the preferred, the equity is not protected. So if the company goes out of business, the first set of monies to be lost would be the equity monies. But small businesses are going to struggle to become larger companies if they don't have access to viable resources. And so St. Lucia is really pushing very hard with the central bank and also with regional institutions, as well as meeting with the banks. How do we create this? Because the banks would be in a much better position to lend money if there was equity already involved. So it would reduce the amount of money that they would have to borrow and give them a greater assurance that the debt's going to be repaid. And I think that coming out of COVID, I have even a greater sense of urgency of resolving that, because I'm excited at the prospect that the number of people who have now used COVID as the reason to change their career. How many people probably wanted to change, didn't want to do it, and all of a sudden this has presented an opportunity. So if you take the project that we're doing in Groslay, we call it T Village, which is next to the fire station, where we've taken that land, subdivided it, put water, electricity in it, sidewalks, designed it out now for small businesses, because that's really what that is. We had 33 lots available, over 300 people applied. All right? And you're seeing all around the country people now moving into new businesses. And I want to make sure that we don't frustrate those persons and that the government is moving in tandem with a lot of those persons in making sure that there are resources available to them and moving forward.
And that's a very, very encouraging words there from you, Prime Minister. And I'm sure that everyone who's entrepreneurial in spirit and saying, oh, well, there is a place for me. And your last words, very, very telling on the direction of the government, not frustrating those individuals. And I think that is the key thing, to be able to work alongside people with their, helping them fulfill their dreams. Prime Minister, I know your time is very limited with us. In fact, we've come to the end of your time with us. But I just have this one final question, and if you could answer us as succinctly as possible. Budget is next week, and we've seen that happening. You alluded to it earlier on. What can we expect in your budget presentation? If you could give us just in a little nutshell, reveal a little something to us. What can we expect?
So the budget is in two parts: the estimates, which is really just numbers, and then the appropriations bill, which would be policy. So the estimates are on Tuesday, along with the throne speech. The throne speech will start giving people some ideas to the policy direction, but it would not be really encapsulating the policy direction. The good news is that we have paid all salaries. We continue to pay our debt. We continue to be in a liquid enough position to continue to do those things. Sadly, there's still a tremendous amount of uncertainty. We don't know how quickly the economy is going to recover. Government has had to give a lot of concessions to small businesses, medium-sized businesses, and large businesses to offset the losses. And so we've absorbed those losses by not charging taxes on a lot of issues. So what government's final revenue position is going to be is still very much up in the air. But what we can say is that a continuation of building a new St. Lucia, continuation of fixing the infrastructure, a continuation of making ourselves competitive. I mean, all this week we were talking about the Headquarters Act, the residency program, and expediting our financial sector. The orange economy, we have a tremendous amount of confidence in it. So there is an allocation for events. We're hoping that we can see at least one event come back this budgetary year. But we feel very strong that Carnival will come back strong next year. So there will be an event probably to celebrate something, as well as being a launching pad to promote our events for 2022. We're excited because the airport project is continuing, and hopefully will come to conclusion by October of 2022. The discussions with the cruise ship pier home porting in the south is proceeding, and that's due to come to conclusion by 2022. The water project in the south, the opening up of St. Jude's Hospital, the introduction of the National Healthcare Insurance Program, the strengthening of this digital ID, and the social net program we're going to be putting in, which will be much broader than it has been before. So the continuation of infrastructural building, and infrastructure is not just about roads and buildings, but it's about institutional strengthening, about policy strengthening, our police officers, the police headquarters, the continuation of the digital cameras, the CSI unit, the crime scenes investigation unit that we're going to be opening up. We just got new engines for the Marine Police, going to the border control. So as I said to you, this year really is a continuation of a lot of the things that we've already started, and despite COVID, is to give solutions the assurance that we have made the fiscal space available and the human resources available, and continue to prioritize those programs. So education, continuing to digitize. You know, when I first came in, I sadly did not appreciate how bad the physical infrastructure in schools was. And I remember sitting with Gail because I wanted to move to this digital thing much quicker. And she was saying, PM, you need to come with me. So you got there, electrical problems, plumbing problems, washrooms were a mess, roofs were a mess. And so we ended up spending $50 million, which really was not programmed. But the moment I saw it, and her department was able to explain it to me, that we made those resources immediately available to fix up those schools. So even to do some of the things that we had to do, we had to step back and improve the quality of healthcare centers. There was no generators. The roofs were problems. People were breaking into the healthcare centers. There wasn't adequate refrigeration, so it means that if you had a hurricane and a community was isolated, you couldn't even store the medicine in that area. So we had 14 facilities that became smart healthcare facilities. The new polyclinic in Dennery, the new healthcare facility in Micoud, which is also going to include dentistry, the new mini hospital going up in Soufrière. The polyclinic now in Groselet is 24/7. So all of these all have come at a significant expense, and I'm just so happy and proud of the fact that we've been able to rise to that challenge. And this year's budget really is to give persons the comfort that no major programs are being cut, that we're continuing with the work that we were in front. And I think that October of 2022 will be a significant milestone in the history of St. Lucia. With the new airport coming on board, the completion of the major roadworks that we would have done because the West Coast Road, the bridge, etc. The addition of some of the call centers, one of the largest call centers in the world is coming to St. Lucia. They're coming down to look at the Daher Mall, which is beginning. And in addition to the Daher Mall, next to it is the Supreme Court. The new police headquarters with the new court systems are coming in. So, look, despite the difficulties of COVID, I remain very upbeat about the future of St. Lucia. And I'm very grateful for the support I receive at my cabinet level. I'm very grateful for the support that we receive technically. You know, something that would be by itself a huge project would be the incinerators. St. Lucia cannot afford to do landfill sites anymore, meaning putting garbage into the ground. Those of you who are old enough to remember shock.
Yes.
Okay.
Saw it every day on my way to school.
Right, in cul-de-sac, where the sand thing is. That big mound was a garbage dump. I mean, can you imagine? We used to pass by that every day.
Every day.
Right? Dayglow is a little bit more hidden, and then you had Vieux Fort. When we came in, the Vieux Fort site was already at its full capacity. So we've now launched the incinerators. There's 4 of them operating on that site. The goal is to be able to now put these incinerators around the island, and each incinerator burns 4 tons a day. So what does that mean? That means now less money being spent on transportation. So the Vieux Fort site, all the garbage that was coming from Soufrière and coming from Dennery was going to that site. And then now all the transportation up north that brings it into Dayglow. That's a lot of money that's being spent on transportation. So if you now can have more incinerators distributed throughout St. Lucia, less transportation, which means now we can spend the same amount of money and collect garbage more frequently. And that these now become small businesses around the island. And we will learn then how to use the ash. We know that if you don't separate your garbage, that it will become a building material. But if we can do what other countries are doing and have renewables that are being burnt, they call biodegradable, that those now we can become a fertilizer. So, you know, these are some of the out products of what we're looking to do. So in every aspect, whether it's justice, healthcare, education, road infrastructure, small businesses, tourism, agriculture, I mean, the new facility that is at in Micoud, in Volette, I don't know how many people have been down to see it. It really is a huge departure from what we had at Beausaint-Joux. The new facilities we have in Union, we're putting a new agricultural center in Union, so we remain very committed. We have some exciting things taking place in bananas. It was a tough year with bananas, with Windfresh going out of business, and we had to step in to save Geest and to be able to save the distribution channels that we had in the UK. Took a tremendous amount of man hours as well as financial resources in the midst of the crisis, right? And I'm just, you know, that's how committed we are to it. The new campaign that we're going to have for bananas of our Inspired by Nature banana, our gourmet banana, that we're going to be marketing and promoting. as well as trying to build back what Windfresh was as the Windward Islands as a distribution channel of our agro-processing. CMOS is just taking the world by storm, and we have everybody now producing CMOS because it's become a great cash crop right here in St. Lucia. So look, I'm very excited, and I want to make sure again that the government is running in tandem with the public of St. Lucia, and that we're making sure that the resources that people are going to need are going to be here, as well as the quality of services. This is a government that is people-centric. And you know, it's disheartening sometimes when people try to say differently. The projects we're doing are community-based projects. Healthcare centers, schools, smart classrooms, roads, drains, sporting facilities. I don't know if you've had a chance to see the new track in Soufriere. You have in Dennery the new facility being laid down there. The one in Deriso has already been done. We have the one that's also being done in Micoud very shortly. The number of fields where lights have been added and the grass has been returfed, canneries just to name one of them. So village tourism. I mean, I don't know if you've been through Ancillary Town recently to see the houses being painted on the main road, the waterfront development that's taking place there, Gros Islet with what's going to be taking place with the waterfront development. So, despite COVID, this government has never used as an excuse, has stayed very focused on building a new St. Lucia and putting ourselves in a position to make a quantum leap. And
once COVID is over, because it will be over. And
well, even if it's not over, Lissa, we have to learn to coexist.
Yes,
we cannot afford to allow the opportunities that are available to go by. And this is where I think that repeatedly we've spoken about being each other's brother's keeper. Yes, okay? Even if you don't want to take the vaccine, you need to take it for your family and for your neighbors and for all of us in St. Lucia. Right? We all have to be all in together. And I can end on saying we can and we will.
Absolutely. Thank you very much, Prime Minister. As we said, your time with us. You've gone over your time, and we're very appreciative of that because the information has been very valuable. The Prime Minister, they're giving us quite an insight into what has been happening at the cabinet level, the decision-making process, giving us an understanding of the thinking behind some of those decisions and how the government has continued to push through despite the challenges of COVID-19. We'll take a short break. Stay with us. We're back as we continue to look at COVID-19, the year in review.
Overnight,
much,
growing
Jesse.
national
A cashless
unrest.
society, a digital cashless
It's not
society,
quarantine
one
we
world
want.
currency,
A vaccine
which has
for COVID-19.
Midtown
Droplets
Manhattan.
of coronavirus.
Macy's iconic
Pneumonia.
flagship. Rand's
Virus of
COVID-19. Set inside.
Track the coronavirus.
Everybody vaccinated.
On the corona pandemic.
Please position to the lockdown.
An infected conspiracy theories.
Bizarre claims.
The truth about the origin of COVID-19 hidden from the rest of the world. And the Chinese.
In this constantly changing environment, resulting in sensory overload, cut through the noise and tune in to the National Television Network, the official source of information, all facts.
What's in the food you're eating? Do you really even know? All the chemicals and hormones used to accelerate their growth. All the artificial flavoring, sweeteners and colors too. We consume and we don't spare a thought for the damage that they'll do. No, think about the children. Think about the children. How will we save them? Chemicals and GMOs are not the solution. Use organic and join revolution.
Excessive agrochemical use, additives and genetically modified foods are harmful to health and the environment. Join the good food revolution. Grow, buy and consume organic. A message from Rise St. Lucia and the Ministry of Sustainable Development with funding from the GEF Small Grants Program, UNDP.
The good food revolution.
And we are back with the COVID-19 year in review. If you're joining, special good day to you. Thank you so much for tuning in. We just got off speaking to Prime Minister Honorable Alan Shastney. Of course, governance and matters of strategy for a country aren't easily exhaustible, but he did manage to encapsulate quite a bit of the work the government of St. Lucia has done in the last year and insight going forward into our next fiscal year. At this point, we would like to welcome back on the Minister for Education, Innovation, Gender Relations and Sustainable Development, Dr. the Honorable Gail Rigobert, who was speaking to us earlier about education, a bit about her other portfolio, which is gender relations. But I want to go back to education, Dr. Rigobert. If you could talk about just the last year in terms of having to, close initially and reopen in September and close again. We had the first case of COVID-19 being announced in September, I believe it was, and of course that did prompt the closure of schools. Again, another attempt to reopen schools in the physical setting. Speak to that as well as the ability of the education sector to continue having relied on the virtual learning space.
Thank you, Jesse, and thanks for having me back. I must say that the decision to close schools is never an easy one. On each occasion we've had to close schools, we've had to deliberate on it, we've had to engage stakeholders, weigh the pros and cons. Ideally, we would love to have all of our students in school. Like I indicated earlier, we are very concerned about the disruption to learning. We are very concerned about our students' health and well-being and the well-being and health of our educators and ancillary staff as well. And so trust me, that is never an easy decision. Moreover, one of the reasons we've had to adopt what we call distributed learning, which really speaks to mixed modality, and by that I mean that there are schools that have done a fantastic job with the online learning. Their teachers are aware of the technology, students have devices, the teachers are logging on time, delivering the material. But admittedly, there are some students who have not been able to benefit to the same extent for one reason or another. It could be that perhaps they do not yet have a device, maybe they've got no connectivity at home, maybe the teacher is not yet comfortable with the technology. And for those students, we prepare packages, physical packages, worksheets that they can work on from home, and we know that is not necessarily ideal. As I indicated earlier, that the ambition has always been, long before COVID-19, to embrace ICTs and technology. We all speak of the ubiquity of ICTs, the ubiquity of the technologies. They're everywhere, in the bank and the supermarket, at home, for recreational purposes, for business purposes. And of course now, we're sensitizing the public. We're encouraging students, teachers, parents to embrace the technology in the area of education as well. Among the challenges that we've had, and notwithstanding those challenges, we've made some progress, but the lingering challenges remain, such as ensuring that every child has a device, and I hinted earlier on to the pilot programs that we had started and ensuring that that distribution of devices program would extend to students beyond or outside of Form 3, and that is ongoing as we speak. The continuing training of our teachers to ensure that they are more comfortable with the technology. But very importantly, an area in which I know we've got a lot more work to do, and that is the sensitization of parents. And I have been asking my team, please engage the various presidents or chairpersons of the PTAs, and I saw something really beautiful happening along the West Coast this week, and that is PTAs meeting, ensuring that parents are more comfortable with the use of the technology, they understand what's happening, better equip parents to assess and monitor what their children are doing. Many of us will acknowledge that the students are much better at navigating the technology than we are. And so as part of our parenting, we need to understand what it is that students are doing online, that indeed they are doing their schoolwork and not engaging in other recreational activities. So I want to applaud the PT. I think it was in Soufriere, maybe Canaries. It may have extended to Ancillary as well, but certainly along the West Coast this week, I saw the PT, the teachers, the parents coming together to ensure that we cure some of the anxieties that parents have with respect to technology. So we continue, Jesse, to equip, to furnish our families, our students with the requisite technologies. And like I said, that's an ongoing process. And I really want to thank the IT team. They worked throughout COVID. They've worked long hours, because there's one thing to convince the Minister for Finance that we get the financial resources. It is another to procure the necessary equipment. Then we have to do the formatting and then go through the various distribution channels to ensure that our students and teachers do have devices. With your kind permission, Jesse, just let me thank the teachers. I know sometimes teachers get a bad rap, and that's regrettable, because luckily I come from a household where I was parented by a teacher. I also taught for much of my adult life, and teaching is a vocation, and teaching always requires of you to do more than perhaps contractually you are hired to do. And teachers, our teachers, do that with all of the verve that they can muster. They do it because of the love that they have for our students and for our nation. And I want to applaud those teachers who have gone beyond the call of duty, who've done so much more than ordinarily they would have done, so as to ensure that the students do not suffer, so as to ensure continuity in learning. And yes, we did craft an education continuity plan, and the stakeholders, teachers, etc., are very much aware of that. But that plan would not be implemented successfully if our teachers did not put in the long hours that they have. And I really, really want to thank them. I want to thank the ancillary staff, because don't forget, with respect to maintaining the protocols, we have to ensure that we have more sinks or wash basins, the hand sanitizer, liquid soap, towels, hand towels, disposable towels. And I've seen the ancillary staff engage in very thorough cleaning of classrooms, more so than they did previously. So all of these stakeholders have had to come on board, Jesse, to ensure that we preserve the health of our students and teachers, and that we make the schools a safe space. I'm excited about the reopening of school. I'm excited because we've had a test run. Like I say to my team, we have to stress test whatever it is that we put in place, because nobody has the formula, nobody has the panacea. We are doing what we can given the information that we have at any given time, the best that we can at any given time. And that is why I reference the agility, the flexibility of the sector, so that we can respond to existing but also emerging challenges. So I'm very excited about the prospect of reopening school. We've had some engagement with the early child education sector. We've also met with privately owned schools who have, that have their own challenge as well, given that they are privately owned, fee-paying institutions. And you can well imagine that given the economic crisis brought on by the pandemic globally, that some families will be cutting back on their expenses, and so private schools have been impacted. We are trying to see how best we can assist them. We have had meetings with the various subsectors to ensure that they are very well prepared for the reopening of school. And thanks to the partnership with health, we've been able to make some adjustments. For example, with respect to social distancing, what is required in schools within a given square footage. So all in all, we're learning as we go along, but forever mindful of our commitment to the children, our commitment to the educators, to ensure that we continue to provide an environment in which teachers can give the best of themselves and that students continue to have an opportunity to learn.
Wonderful. Final question, if you could just wrap up our interview. Okay, we're running out of time, Dr. Rigobert, but we do wish you all the best, you and your ministry all the best, especially with the vaccination exercise. We know that your sector is going to be targeted next by the Ministry of Health and Wellness under this campaign. Thank you so much.
Okay, and now we want to be able to go across to our Police Commissioner Milton Daisy. He's back with us. Commissioner, he's online with us at the moment. Commissioner Milton Daisy.
Yes, good afternoon.
Oh, thank you so much. Thank you so much for your return. To ask you what we've seen in the last week, and certainly even before then, but perhaps it was happening on a smaller scale, but what we've seen is an all-out defiance by certain segments of the population to the role of the police in enforcing the COVID-19 protocols. This certainly perhaps has not come as a shock for you because it's not your first rodeo in policing, but certainly I think that for persons looking on, we are definitely shocked by the scenes that continue to go viral. So from the Royal St. Lucia Police Force, I know you have said that there be a zero tolerance policy when it comes to this, but speak to us about the morale of your men and women at this time, because they are putting their lives at risk, not just on the physical front of being hurt by some of the missiles that are being hurled at them, but certainly too exposure to COVID-19. Yes, they are wearing the mask, and some of them I see have donned the gloves as well, but there still remains a possibility of having to go into a crowd and to get into physical tussles. Certainly it exposes them on an additional front. So how are the men and women faring, and how do you continue to inspire them, if you will, on a daily basis for them to go out there and still do their jobs despite the opposition that they're facing?
Yes, actually with constant communication to them, not just myself, but the commanders. We communicate to the commanders, and they would be communicating, especially the briefings before these officers go out into the public. Actually, the officers are still motivated, still willing, and it is our job to continue to do the job. However, certain response has to be adjusted to meet this type of behavior. And we're not expecting that type of behavior from persons who are just not wearing a mask or have been in an area longer than they're supposed to. So we have to adjust, as I said, we have to adjust the way we respond to these things. And we are hoping that individuals would change their behavior and to cooperate with the police. And even before that is done, persons would observe the protocols. That's all we need to do. That is, you wear your mask, observe social distancing, you sanitize, and there are times for closure. Just observe the times for closure, and we would have no reason to come to you for anything. And I think that one of the things that keep the officers going is that we keep informing the officers that they need to protect themselves too. In as much as persons would be doing that, displaying signs of violence towards the officers, they need to protect themselves. We keep telling them that they need to assess situations before they act. You don't just walk into situations, and if there are two two or three of you and think that you would be able to quell a situation that is happening. We have the means of calling. We have radios, telephone where you could call for backup, and especially in the case of Sufra and Rosalie, that's what was done. The officers called for backup, and other teams came in to take care of the situation.
We've also seen the same sort of treatment meted out to the wardens. One of the public concerns is that the wardens are perhaps not sufficiently trained in order to be able to de-escalate situations. We do know that you have some senior police officers alongside them, but have you assessed the situation, and are you now moving into doing some additional training for the wardens?
Actually, the wardens were receiving continuous training to develop them and to enhance their skills. As we have mentioned before, they usually go out there with senior officers to assist them. Where on the job they would receive on-the-job training, they would receive briefings during their session. They would be guided according to the law and what to do, what not to do, how to attend to situations. So I believe that I am not saying that they are to the level that they would be able to perform as a regular officer. And again, that was not the intention. The intention was for the wardens to go out there where just encouraging persons to comply, and we were expecting that person to comply. And that is why I'm saying that where persons do not comply, they would call for assistance, and another team would come at their rescue. So all in all, the wardens, I believe, what they were brought in for, that most of them, I should say, are doing it, and I feel they are good at what they are doing. And probably it's just that some of them they feel so comfortable that they are going over what is expected of them. But I must say that it had been a great assistance to the force, because with the wardens, what we were able to do is to have individual, other police, regular police, senior police officers to be redeployed in other areas whereby criminality was on the rise and so on. So I believe it was a very good initiative to have these additional numbers to the police force.
Mr. Daisy, going back into the year, we saw that the closure of the borders, that initiative of the government of St. Lucia to reduce the risk of transmission or it entering our country, was significantly undermined by the illicit border entry from neighboring territories. Can you speak to the rate with which this perhaps is still occurring? To what degree are you still intercepting these attempts?
Actually, as the months progress, we were seeing an increase. However, I believe some measures have been taken, especially by Ministry of Health in certain areas, such as in the east, whereby persons come in and before this is reported to the police, they go to an institution where they are tested, and having been tested, the Ministry of Health believes that this is actually the aim is for them not to spread any further COVID-19, and where that is done, they are satisfied with it. But it is still against the law to enter the country without permission. It is an offense, which we still have to be out there. We are patrolling during that time. Many persons were arrested, and we had canoes confiscated and so on. So the officers at the unit were out there busy day and night, 24 hours a day, where they perform preventative duties. And actually, I must say that the engines of our patrol vessels worked so hard that government had to replace 3 of those engines, and it's not cheap engines. So I think the officers on the whole, they are dedicated to doing what they are supposed to do, and then we will continue with the help of the resources that are being provided to us.
Thank you very much, Commissioner of Police Milton Daisy. We do appreciate the work that your institution does in continuing to serve and protect the population.
And perhaps, Commissioner, just before you leave, just one quick question again. You know that we are in a new curfew beginning Wednesday of next week, and certainly there's going to be an adjustment again for the holiday period for Easter. Can you just speak to us, perhaps speak to the public about the strict adherence to the protocols coming from the police department when the Easter period comes around? That will be April 2nd.
Yes, actually we are moving into as the protocols have changed, we are moving into curfew time of 9 p.m. So this would give persons, I would say, a leeway into doing what they have to do out of the road. But I must inform persons that they should not take advantage over it. 9 p.m. would be, 9 p.m. is 9 p.m. and that is sufficient time for persons to get to their homes, especially those without pass. And even if you have a pass, the pass is to assist you in getting from your workplace. It has to be work related. It's not that because I have a pass on my vehicle that I would be using that opportunity to move around and so on. So it is specific to the duties that you perform. And coming into the Easter weekend, actually the curfew would be brought back to 7 p.m. and we are expecting that everyone would observe the protocols. And one of the protocols being that there should be no socializing, there should be no beach parties, no river line, no dances, and so on. We no loud music permit. In fact, whether you have loud music permit or not, or whether you require the loud music permit, you will not be permitted to play any loud music, whether it be from vehicles, which we commonly see now, or from these amplified sets. So all in the effort of trying to further reduce the transmission of the virus, which we have seen a slight decline in, and that by observing the protocols and adhering to all the measures in place, if that is done, and we are hoping that sooner than later, and especially since you have the vaccines in effect, that we will see further opening of businesses and so on. So the police, as I said, will be out there in full force. We will be effecting our patrols and so on to ensure that persons observe. And I must indicate that and to everyone that they need to observe the protocols, especially out there. Okay, you need to observe the times that are given. You need to observe the no gathering. You need to observe this because the police will be out there, and we would not like any conflict between civilians and police, because the police is actually out there to assist you. The police is out there to assist everyone. So when the police comes out there, do not hesitate in causing, when they ask you to go get in or get out of there and go to your homes. In fact, I have said it, the police should not be asking anyone to do that. We should be responsible and do it. It has been a long time. It is a year that we we have been out there saying that, and persons need to obey. I must indicate too that yes, the police were able to achieve some of what we set out to achieve. However, with the help of the fire service, I must call out to the chief fire officer and his men, who, most times, especially for pickets, they were using the transport, and once the police was going out in any COVID-related activity, the ambulance would have been involved. So I noticed Mr. Joseph, well, he's not there, but let me just convey to him and his men my gratitude in the assistance that I get. And fast, I would say that they respond very quickly when we call them. They have been that cooperation. Also to the CCC, the Swiss constituency police officers, the constabulary team, they actually assist us. To date, we still have officers from this from the constabulary that assist us with regular patrol. They are assigned to us. They have been still and deployed by us, and they continue to provide good support. Yes, for us.
Thank you very much, Milton Daisy, Commissioner of Police, for your time. Of course, the resolve and determination of the Royal St. Lucia Police Force has definitely been tested in the last year, and not just but the non-adherence to the protocols, but definitely being able to meet all of the requirements that were required in terms of enforcement under the COVID-19 protocols and regular policing here on Ireland. Thanks again.
Yes, you are welcome.
Bye-bye.
If I may add, Jesse, that with all the protocol issues that we had to deal with, we were still able to reduce crime by 18%. Yes, crime was there was a reduction by 18%. So it was a challenging year, but I must say, with the assistance and help, the dedication of the police officers, we were able to achieve this.
Commendations to you and your men, sir. Thank you so very much. 18% reduction in crime this past year. Thank you so much.
And certainly, Jesse, that most, when we speak of crime, and certainly in the layman's mind, we only think of it in the context of homicides, because of course it's the most spotlighted. But there are other crimes taking place, whether it be the burglaries, robberies, white collar crimes, yes, and certainly you do have the sexual assaults and so forth, and there has been a reduction in overall crime. While we may see spikes of the homicide at this point, but overall crime is down in St. Lucia. Yes.
Wonderful. We continue our year in review, having back on, as promised, the Chief Medical Officer, Dr. Sharon Belmont-George. Good afternoon, Dr. George.
We also do have with us the immunization manager, who's Assistant Principal Nursing Officer, Tekla Jean-Baptiste, is with us.
Wonderful.
And we're talking inoculation, the vaccination, the national campaign to get St. Lucians protected. So perhaps we can start with Assistant Principal Nursing Officer Jean-Baptiste. Good day to you. And perhaps you have some latest figures for us with regards to the number of St. Lucians getting vaccinated. You know that throughout the week we've had several vaccination sites operating in the various communities right outside our very own office, Jesse, the VG Sports Complex. We saw the setup when we came Monday morning, and some people were like, what was happening? What's going on? And to see that the numbers coming through there.
St. Lucians knew.
St. Lucians knew, and they were coming through, and certainly I must say very well organized as well. So Nurse Jean-Baptiste, can you speak to us about what we have seen for the past 2 weeks on the ground with St. Lucians getting vaccinated?
Do we have Bishop Baptiste on air, online?
Hi, good afternoon.
Okay, there we go, rectified.
Wonderful.
So this is, yes, audio. Thank you so much for joining us today.
Yeah, sure.
I was asking pertaining to our vaccination sites in the last 2 weeks. We've had quite a number of solutions. The last figures that I knew of, we had some 12,624 St. Lucians getting vaccinated, and I know that number has been updated. So give us the latest.
Well, as you know, we launched our campaign on the 17th of February, and where we started off with our frontline workers. And for the 2 weeks following this, our main focus was really on ensuring that our frontline workers, our police officers, our healthcare workers receive the vaccine to ensure that they are protected. As you know, these target group, they are at very high risk of contracting COVID-19. They are exposed, they are in the front line. Once we had received our first donation of vaccines from India, we rolled out into the community. We rolled out into the community at the various vaccination sites across Ireland. I must say, Lisa, that the response has been very, very positive. Our last figures as of yesterday was 17,389. This is really, really a positive response for the National Immunization Program and for St. Lucia on the whole. This says to us that our citizens see the value of receiving the vaccine. They see the need of being protected. And we know that vaccines is a public health strategy that would help, fight that pandemic. And I am happy to see that our people are responding. In terms of the rollout, for the past 2 weeks, we have been focusing on persons in phases 1A and B. We continue to do so, especially our elderly population and persons living with chronic, with comorbid conditions, persons living with asthma, diabetes, high blood pressure, heart conditions. We know that these persons are at very high risk of developing the severe form of the disease, of the virus, if they're infected. And we know that they too, if they become infected, they can suffer the adverse outcomes. And we know death is one of those outcomes. We see the rise in numbers of deaths worldwide, and even right here in St. Lucia, we are almost at 50 deaths. So this is one death per day is just one too many. And we are ensuring that this segment of the population, they are protected so as to, reduce the possibility of mortality as it relates to COVID-19. For the past 2 weeks, the campaign in the community had really been intensified. Today, we are at the VG Complex and also at Corinth. Next week, we will be scaling down a little, and this is sort of deliberate. Of course, we know we have a large number of persons who really who are part of this target population in phase 1A and B, and they can't access the wellness centers. We have elderlies out in the community, we have persons with mobility issues, and they really can't access. And next week, our focus is really going to be meeting these people. So the community health nurses, along with the teams will be out in the various communities and the institutions, the elderly homes, to ensure that those persons are vaccinated. It is important that these persons are protected. In terms of our vaccines, we are expecting our next batch of vaccines in the coming weeks, and as such, we would, once we've covered most of our persons in our phase 1, we would start transitioning into the other phases. It is important that at this point we include persons from other sectors, persons who are at not very high risk, but at medium risk of contracting the disease, because by nature of their interaction, their daily interaction with persons, that in itself would put them at risk. I speak of the commercial sector. I speak of hotel workers, transportation, the minibus drivers, our teachers, persons in the education sector. That being said, we are encouraging persons to continue pre-registering, because this is very important for us. The pre-registration, it helps us plan, it helps us better able allocate our resources, our teams, the vaccines, and it is really for our logistics, the planning and logistics of the rollout of the vaccination campaign. So we encourage persons to do so as we prepare to transition into the other phases.
Jean-Baptiste, and we want to bring in quickly Madam CMO. Thank you so much for coming back with us. In the remaining minute that we have, we want to be able to give you that chance, and just to look forward, now that we are at the vaccination point, where do you see us going from there? We know that you've reported, though we're not out of the woods, but we've seen some reduction in the flattening of the curve, in the transmission rate and so forth. So speak to us about moving forward. What do you see for us?
I think based on where we are, we have just managed our third wave, and we continue to get to a safe place. But I just want to appeal to the public that we still have too many active cases within the community. We still have over 100 active cases within the community. And a lot of our risks for introduction are still there. So the vaccine, it really provides a light in the tunnel, the end of the tunnel. It is one of the most cost-effective public health measures. So we're extremely grateful to have it available to the public, and we will continue to appeal to the public, like Nurse Jean-Baptiste said, to take the vaccine. It is really going to assist us to get back to some form of normal life in the near future. We are hoping to get more so that we can achieve herd immunity, so that we can actually feel covered, we can actually feel safe, and to see the true effect of the vaccine working for us. However, we have received just the first, most of our persons who have taken the vaccine is only the first dose that they have received so far. So it is important, and I will continue to appeal to the public that we continue to maintain the measures that are in place. The use of the face mask, avoid crowded areas, keep a safe distance from others, and the infection measures of continuously washing your hands frequently. We have some concerns. We know that the curfew is going a little later tonight, like Mr. Daisy indicated. Although it is going later, it is not an indication for persons to hold social activities. We are not ready for that yet. And social events are not approved. Mass crowd events are not approved at this point. So we want a level of responsible behavior. The police cannot be everywhere and in every community. So we really want, at the level of the community, that we make responsible choices for our safety at this point. So I just want to continue to ask the public to work with us. Like Lucia Baptiste indicated, there are certain moderate risk groups that we have invited to come in, such as the teachers, who are an extremely important group, our bus drivers as well, and our tourism workers as well, who work with persons who are coming in. So those groups, we also indicated for them to go in to get immunized. And I just want to indicate that for persons who've not gone today, we are at Corinth and at the VG complex, and it's running very efficient. There isn't a long wait. So you can still use the last few hours of the day to go down and quickly get your vaccines. And if you have any elderly relatives that you're aware of who can't come to us, please either take them in or notify the nearest wellness centers. We really want to get to them this afternoon. So I want to just thank all the public and the sector that have worked closely with all of our officers within the Ministry of Health. And also I want to recognize the command center for the level of leadership that they have shown in terms of the discourse, and they've really stayed the course throughout the year in terms of the daily assessments that we look at where we are, what needs to be done, and bring in various sectors based on the situation. I think they've really been one of the resilient groups in molding where we are and where we are going. The ministry, our various departments, they've really steered the course throughout and really sacrificed a lot. So I really appreciate the public primary care teams, the hospital, and all of the extended services. I can't name all of them. And I want to let the public know, as we go into a safe place, unless we work to stay there, we will be managing waves later. And we need to protect our health and safety. That's really the most important thing that we have. So I want to thank everyone who has been working with the ministry, and let us continue until we successfully, the COVID-19 no longer remains a threat for us. Let us stay the course. We know we'll be back till the end of the year. Thank you so much.
Thank you so much for that, Madam CMO. And as we said earlier to the police, thank you for your service as well as the service of all the health workers in St. Lucia. And as we close, we know that COVID-19 definitely to manage and to mitigate has come at a cost. Some figures to share with you just as of October. I mean, so just imagine that October of last year, this is where the numbers stood, and by now, where we are at March 13, 2021, these numbers would have risen. But just quickly, quarantine facilities, the expenditure there was $6.6 million. Looking at the Cuban Brigade, we had some $8.8 million there. For health promotion, personal protective equipment, lab equipment for the Ezra Long Lab, medical equipment, emergency medical services, sanitizing supplies, pharmaceuticals, and frontline response. That stood at $13.9 million. So looking at a total, incorporating so many other things like transportation, rental of tents, and so forth, at $38.1 million. Also, the income support program, total expenditure there was $7.215 million, and looking at some 6,729 applications. Also, the government of St. Lucia spent some $3 million through the SSDF targeted program, looking at early childhood, primary school and secondary school. Secondary school students got $1,500. Primary school, they got $1,000, and the early childhood got $500. And there were 2 recipients per household. Also, a little known fact here, as part of the stimulating of the economy, there was a policy for increasing the subsidy on flour purchased by bakers, and we saw that the bakers got that subsidy from $12 to $17. Definitely there, given that sort of intervention by the government to assist with being able to provide for the public, because we know that keeping the staples are very, very important, keeping staples in the pantry, Jesse.
And just to add to your stats there, coming from the National Insurance Corporation for the Economic Relief Program, as at yesterday, a total of $66,570,559 have been spent overall in this program. The total number of applicants that have been processed, 70,994, and the average being paid out per individual is $937.69 to each individual per month. And we know that this program, economic relief coming out of the purse of the NIC, was given for 6 months to try to stem the tide of the effects of COVID-19. Many persons would have been laid off during this period. We have so far seen coming in from July, the reopening of the tourism sector, that this situation has abated somewhat, but persons still continue to require assistance, and hence the institution, the kicking in of the social stabilization plan, as well as the 6 pillars of the Government of St. Lucia's economic recovery and resilience plan. Also to note, as part of the strengthening of social protection systems here on Island, the electricity support program that was instituted by Equity, the Ministry of Equity, is also doing well. The $4.5 million that has been allocated for this project to help St. Lucians who are struggling to pay their bills.
More than 3,000 households.
More than 3,000 households. 3,028 households have benefited from being part of this program at this time.
Okay. And just to give you where we stand globally with COVID-19, the cases are 119 million, recovered 67.5 million, and the deaths are 2.64 million. And locally, we're looking at 4,011 cases. We also have recovered 3,758 of those 4,000 cases. And sadly, our deaths are at 49 at this time. And we really want to be able to say to our brothers and sisters who've lost their loved ones, and certainly people that we know, Jesse, who have passed due to COVID-19, COVID-19 related deaths, we want to say to all of us that there is a light at the end of the tunnel. And while we are pained in separate ways, however, we have to keep the faith in God, because without Him, we're not able to overcome our personal challenges. And with that being said, we want to go across to Pastor Sherwin Griffith, who will have a moment of prayer for our lost ones.
Jesus Christ declared in John 14 and verse 27, "Let not your hearts be troubled, and do not be afraid." Shall we pray? Our omnipresent and omniscient Father, giver of life, God of all comfort, thank you for life. Father, our present experience shows us that we live in an unsettling world. There is no such thing as security here. Thieves break in, accidents happen, illness strikes, terror assaults, and death comes to all. No one is immune. No human institution can guarantee our safety, Lord. The locks on our doors, the airbags on our cars, the helmets on our heads, the life jackets under our seats, the medicines on our shelves, they may help, but they do not come with promises. But thank you, gracious Father, that your Son Jesus Christ, in the face of death, left a promise of security in Himself. He encourages, "Let not your heart be troubled, and do not be afraid." Thank you, Lord, for these comforting words. May they today, in these unsettling times, comfort all those who mourn the loss of loved ones, especially due to COVID-19. May your grace and love encourage those who are suffering today in homes or hospitals, from this raging coronavirus. Thank you for all those graciously serving so sacrificially to rescue those who are suffering. Thank you for the wisdom you have granted to leaders to contain this pandemic. Father, we know that the last enemy that shall be destroyed is death. But Father, thank you that there will be a resurrection. Until death is dethroned, God, and swallowed up in victory, help us to live victoriously. In Jesus' name we pray with thanksgiving. Amen.
And a moment there for us to remember those that we have lost due to COVID-19 in this last year. And Jesse, it has been a very trying one. However, as our theme for independence tells us, we are a resilient nation. We will, yes.
Yeah, absolutely. And just to go back to the words of the Prime Minister, echoed by Dr. Rigobert, you know, we shouldn't let uncertainty paralyze us. We should be able to be adaptable at this time. We will, St. Lucia. Just looking at the year in review, we hope that you take it all in stride. And going into this new year, this fiscal year, we have the budget proceedings to happen this coming week. We encourage you to keep the faith and hold a strong resolve about you. Continue to adhere to the protocols, the use of the face mask, hand sanitizer, washing of your hands with soap and water when you can, and observing the 6-foot distance. We have seen what breaches in the protocols have done. They have resulted in a wave of coronavirus practically, and we encourage you to continue to adhere, continue to abide by, you know, what is being put out by the officials, so that we can begin to come out of this stronger than ever.
We do hope that you have enjoyed being with us for the better part of today, Saturday, 13th of March 2021, 1 year on since COVID-19. We do hope that you've been able to get some insight and understanding of what goes behind the decision-making process when it comes to COVID-19 from both the health perspective and as well from the governance perspective. I am Melissa Joseph alongside Jesse Leos, telling you thank you and see you soon.